Good morning, everyone, and welcome to the House Committee on Health and Human Services and Elderly Affairs. Before we get into the testimony of the day on the various bills we have scheduled, I'd like you to join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. The first bill for us to consider today is House Bill 598, and for the purposes of introduction, I would like to recognize the prime sponsor of this bill, Representative Jess Edwards.
So, good morning, Mr. Chair and members of the Health and Human Services Committee. I'm Representative Jess Edwards, representing Rockingham District 31. That's Auburn, Candia, Chester, and Deerfield. I'm here today to introduce House Bill 595, excuse me, is that right? 598, relative to funding maternal mortality reviews. This bill came about in my role as Vice Chair of the Health and Human Services Oversight Committee last term. I see Representative Pearson here today. I don't know if he's intending to speak on this, but he's been our chair. And it was during testimony about the maternal mortality process that it became clear that they could do some good for our citizens if they had some money. And they just hadn't asked for it before. So what we proposed during the oversight hearing, and what this is now the execution of that promise, was the establishment on, if you look at it from line 9 on the first page to 27, it really describes the establishment of the fund, and it's got 6 bullets on the good that they could do, ranging from data analysis to quality improvement at birthing facilities, to improving coordination of chronic health care conditions, to, and I think this is a big one in New Hampshire, unfortunately, on 21, to help individuals with substance misuse screening, treatment, and recovery, screening for mental health conditions, and then public outreach and education so that people understand the importance of good prenatal care and some of the warning signs that they may have a problem. So that's really the bulk of the policy question before you. Shall we establish this dedicated fund? The first sections, line 1 through 5, is simply pro forma telling the treasurer that, you know, we need to have those monies transferred. And then the rest of this is a finance issue that would go to Division 3. I will just headline for you, though, for situational awareness, that it moves marriage money to help fund a program to help babies and moms. So we're gonna take the marriage money that we're collecting from marriage licenses and marriage officiate licenses, and we're gonna move them from domestic violence in this bill to helping with our infant mortality issues. That's on the tune of about $450,000. But to help compensate for that, I'd worked it out with the chair of criminal justice to increase the domestic violence fees, which were bizarrely only $50. You know, it costs more to get married than it does to, you know, beat somebody. So we're going to raise that up to $250, and we're going to dedicate those fines. They were already dedicated, but this is at an increased level to backfill the hole on domestic violence. There will be some concerns raised because this is about the third term I've discussed this, that, oh no, if you don't do these dedicated funds, we're not going to fund domestic violence the way it should. It's not true. I made a promise that I would use Division 3 to make sure the domestic violence fund was protected. And in fact, in this last budget cycle, I increased the domestic violence, the application of general funds, by well over the inflation rate. So I'm an advocate of making sure that we have good, healthy domestic violence programs. I'd like you to focus on the policy issue if you wouldn't mind. And trust me that I'm not going to let the finance part of this have problems as this works its way through its budget cycle. So with that, I can take questions.
Questions from committee members. Representative Weber.
Thank you, Mr. Chairman, and thank you for taking my question. I'm having a little hard time getting around the issue of confining questions to the policy because there is no health policy here because the program is already established. The issue here, is it not true that the issue here is only the funding piece?
No. No, this establishes a special fund for maternal mortality review that's chartered with the 6 elements that it would do. None of this is in law, and this would establish that fund for the first time. So that's the policy issue. Shall the legislature establish this special fund to provide financial support to our maternal mortality efforts? And I'm asking you to say yes to that.
Okay, and I have a follow-up, if I may,
Follow-up,
Mr.
sure.
Chair. So in choosing to do that, I really want to know why you chose to do the smoke and mirrors of taking from one fund and going to another and then replenishing that fund. Why not just start with the fees in Section 5 and take them around to where you wanted them to go in the first place? Why do we have to do the puddle jumping?
So I take issue with the description of it being smoke and mirrors. It's clearly in the legislation. I'm clearly here testifying what the impact is. So I don't care to answer that question. I think it's offensive. It's not smoke and mirrors. It's a clear financial issue that's not really a policy issue.
Yes, Representative Merchant.
Thank you, Mr. Chairman, and also thank you for taking my question. Given the fact that this money is not going to help the person who's paying it, does it in fact become a tax? Because in essence, the fee is something that has to benefit the person paying the fee. So if the person paying the fee does benefit from the fee, are we not really taking a tax and calling it a fee?
So I absolutely love the question because it really juxtaposes the situation that we're in now. And let's say I agree with the general premise that a fee and a tax are different and that a fee is intended to provide a government benefit to the people who are paying it. Currently, the money from marriage license is going to domestic violence programs, as though there's a causal link or a nexus between marriage and beating your spouse. And that, I think, is a more spurious analysis or a metaphor than having this marriage money spent on improving infant mortality issues. I mean, you would think that in most cases one of the outcomes of marriage is children, and this fund would be to help provide for a healthier New Hampshire environment for those children to be born. So you could still make an argument, I think, that this is not really a fee. I think it's more of a fee than the current status quo. It's less bad.
So are you saying basically this is really a tax and not a fee?
No. No, I'd say that it's less of a tax than the current statute, and that to the extent that one can rationalize that marriage license money should go to other programs, I think it is more consistent with the purpose and value of marriage to have the money from those marriage license fees directed towards the healthy birth of children as opposed to being directed into a domestic violence program. Most domestic violence occurs between unmarried couples. So, you know, and this is a partisan issue. I get it. I've talked about this 3 terms now, and I understand that my support for the institution of marriage is probably a little different than many. But this is really a policy issue. Do we want to establish this dedicated fund? Do we want this dedicated fund to have those 6 enumerated responsibilities? That's what I think the primary concern of this committee is.
Thank you. Representative Leon.
Thank you, Mr. Chairman, and thank you for being here. My question is to the increase in fees on the domestic violence. It seems that only $50 of a fee for a somebody who is found guilty of a domestic violence offense is incredibly low relative to the other, and that part of fees is a restitution to prevent other victims in the future. Is that understanding correct, or am I getting something wrong here?
Okay, so far we've had a discussion on taxes versus fees. When we talk about the domestic violence, that's not a fee, that's a fine. That's punishment. And so that $50 under current law is already going to the domestic violence program. And in order to help backfill the money that they may not have because the fiscal note's not complete, we're increasing the fine from $50, which is ridiculous, to $250. And that was done in coordination with the chair of criminal justice. So he's a co-sponsor of the bill. Does that answer your question?
Follow up?
Thank you. Mostly. My follow-up question is, does that mean that when there's more domestic violence convictions, there's more funding going to the domestic violence fund? And if it's reducing, it might be lower? If it's less of an issue?
Well, sure. There is that correlation. Assuming that the criminal justice system keeps up with charging and prosecuting domestic violence. I mean, that's sort of a random element in today's environment. Are we going to hold people accountable for their criminal conduct? But assuming that remains constant, yeah, there would be a direct correlation. And in a way, that kind of makes sense. You know, if there's more domestic violence, there would be more money going to it. If there's less, there would be less. But in any case, the vast preponderance of the money is coming from the general fund and from federal money. And you have my assurance that as the chairman of Division 3, I will do everything I can to protect the general funds going to fund the domestic violence program.
Any other questions? Yes.
Thank you, Mr. Chairman. Thank you for taking my question. So I'm assuming that you're saying that the domestic violence fund will not in any way be harmed by this. And the second question is a simple one. Is this a non-lapsing or a lapsing fund that it's going to be going into?
I think this is a lapsing. I think we try to default to lapsing, but I honestly don't know the answer to your question.
It was just not in the, so I'm just wondering if it's a lapsing.
Which one is not, which one are you asking about? The new fund I
Yes.
want to establish?
Yes, the new fund.
Okay, I was confused. I was thinking we were talking about the other programs. That's a good question. I would not have a problem with making this non-lapsing because relative to the general funds, this is a small amount of money. So having this be non-lapsing, I don't think creates a financial discipline issue.
Thank you.
Other questions? Yes.
Thank you. How many maternal deaths did we have last year or the year before?
We have people from the department here
Okay.
that can provide you
Someone
the
from the
detail.
department has signed up to speak later.
Okay,
Yeah.
thank you. Thank you.
Yeah, it's a good question.
Other questions? Oh, I'm sorry. Yes.
Thank you, Mr. Chair, and thanks for taking my question. So this review board already exists, and so what does this do to the baseline? I'm just trying to get a feel for how much it actually grows, what's going in. You say it's kind of scattershot, how it's being funded now. So where's the baseline at now, and how does this impact that baseline?
The official baseline is 0. Apparently, they're not set up to receive any money, and the board exists, I think, on shoestrings and borrowed manpower from somewhere. But the department is here, Ms. Tilley, and I forget Lisa's last name. It starts with an S, but they could provide you with those details.
Thank you.
Other questions? Representative Weber.
I'll try mine again, and I'll apologize for the inartfulness of my phrasing the first time around. So the board and the review already exist. Why is this not purely a matter for the budget cycle and finance and ways and means rather than bringing it to Health and Human Services?
Well, first it starts with the department and the governor. The legislature doesn't normally just step in and say we're going to throw money at you. We've not had a request in prior years, and as we heard in HHS oversight, the lack of funding was hindering some of the good work that they could be doing. To Representative Nutter Upham's question, at least the implication, is will this money get us any improvement in our maternal mortality rates? It was testimony in HHS oversight that it would be contributory, that it would help with their mission. And I don't know. We have so few babies in New Hampshire. I'd like that to be a good situation as much as possible. Did I answer your question?
Other questions? Okay, I see none. Thank you very much, Representative.
Thank you.
Okay, going forward, again, now after we get past the prime sponsor in each bill, we are going to be limiting some subsequent testimony to 3 minutes. So please be mindful of that as we proceed. The next person signed up to speak on this bill is Representative Mark Pearson.
Thank you, Mr. Chairman and members of the committee. My name is Mark Pearson. I spent 6 happy years in this committee, the last 2 as chairman. I presently chair Children and Family Law, and I'm happy to be a co-sponsor of this bill. America leads the world in many things, but one area where we lag woefully behind is in the area of the morbidity and mortality of women who are about to give birth or who have just given birth. I think I read we are 20th amongst first world nations. While we can intuit reasons for this bill, good solid data is much more helpful in identifying specific issues along the way towards data-driven conclusions that will yield much-needed improvements. This bill calls for getting that data, line 15. Our legislature is notorious for passing legislation that is wise and feels good and is left languishing for lack of funding. This bill has some funding mechanisms in it. I will leave the explanation and defense of the specifics to those who crafted the bill. I'm simply here as a fiscally conservative and compassionate Republican to encourage you to enable our state better to support women and their babies in this area of great need. That is my testimony, Mr. Chairman. Thank you.
Thank you, Representative Pearson. Questions for the representative? Yes, go ahead.
Thank you, Chairman McDonald. I have a question that another question I'll save for further testimony, which is kind of a prequel to what I'm about to ask you, but that is, you want data, it sounds like. You want more information, and my curiosity is, can't we just look to some other states as far as data acquisition goes? Can we look to some other states? Because I suspect New Hampshire's not entirely unique in this regard. Can we look to other states and what they've already done just to maybe save some money? Thank you.
Thank you, Representative King. You are singing one of my songs. I tell people, I tell myself, if you're crafting a bill, find out what other states are doing. That data will help us. I think we also need to know how we're doing here.
Okay, thank you. Other questions? Okay, I see none. Thank you, Representative. Okay, also signed up to speak is Elisa Sirois from the Department of Health and Human Services. Whoa.
Good morning. I'm Lisa Sorais, Bureau Chief for Population Health and Community Services. Within my bureau sits the Maternal and Child Health section, which oversees the Maternal and Child Health Review Committee, as well as a lot of work that is done with this population. Coming around is the 2022 annual report of the Maternal and Child, the Maternal Mortality Review Committee that was presented to the HHS Legislative Oversight back in December. And that's available online as well. In 2012, RSA 13230 established the Maternal Mortality Review Panel for New Hampshire. That review committee is charged to conduct comprehensive multidisciplinary reviews of maternal deaths for identifying the factors that existed at the time of death, as well as data analysis, and de-identified then review of what happened so that recommendations can be made to hopefully reduce or prevent maternal deaths moving forward in our state. There was a question previously about other states. Most states in the US do have maternal mortality review committees. Here in New Hampshire, ours is a multidisciplinary committee that is made up of obstetricians, family practitioners, nurses, community organizations, social services, many of the professionals and organizations in our states that touch the lives of a pregnant woman and then postpartum. There was a question asked about the number of deaths. So between 2020 and 2021, there were 11 pregnancy-associated deaths. And when we use the word pregnancy-associated, it's pregnancy through 1 year after the end of pregnancy. And so it's important to note that maybe while 11 seems like a small number, it's 11 too many deaths of our women. And there's much larger numbers when you think about maternal morbidity. And so those are our near misses that are costing our states and our programs much money to then support and help the mom through the process afterwards. So those 11 deaths here in New Hampshire were primarily made up of substance use overdoses, then followed by cardiac and coronary conditions. The additional non-lapsing funding that potentially this bill would propose, and I also just want to take a minute to thank Representative Edwards for his efforts in bringing this bill forward and hearing the concerns and the recommendations of the committee. So thank you for that. The proposed funding in this bill would allow the Maternal Mortality Review Committee to enhance the work that's happening. And so currently it's federal funding that is supporting this work. But due to the minimal funding, there's only so much that can be done. And so the additional funding here is really two-pronged. So the first would allow for additional hours of data extraction, which would allow us to learn more about what has happened in these deaths. And then it would allow funding for the implementation of the recommendations. So there's currently no funding to support the recommendations that come out of the committee after reviewing these deaths. There are some efforts, of course, across our state looking at some of these, but nothing dedicated to this committee's work. And so most of the deaths that are presented in the report, you'll see, and as I mentioned, are related to substance use. And so you'll see a lot of those recommendations are focused that way because that's what we saw for deaths the past 2 years. And so while this funding will support the enhanced work, it is worth noting that there is concern of removing the funding from the domestic violence work over to the maternal mortality committee, because their work is also much important for the
Okay,
safety
if you
of
could start
women.
wrapping up.
Thank you.
You don't have to wrap, I mean, are you all set?
Yeah,
Okay.
yeah, I'm happy to take any
Okay,
questions as
great.
well.
Questions? Representative Shapiro.
Thank you, Mr. Chair, and thank you for taking this question. Earlier testimony referenced infant mortality. Does the Maternal Mortality Review Board deal with infant mortality as well, or is that a different group?
So we have two different mortality review committees in our state. There is an infant and child fatality review committee that is charged with separate work, and then there's the maternal mortality. So this is specific to the maternal mortality.
Thank you.
Other questions? Representative Leon.
Thank you, Mr. Chairman, and thank you for being here. Is this committee focused on maternal mortality, or has the scope expanded to maternal morbidity? I understand that's also an issue, but it seems tasked specifically to mortality in my reading.
So the charge of the committee is specific to mortality, because the direction is set by the RSA and by CDC guidance because this is a national effort to look at maternal mortality across the country. But there are conversations of what can we do through our recommendations to prevent getting to the mortality piece, which of course focuses then on the morbidity.
Thank you.
Other questions? Yes, Representative McLean.
Thank you, Mr. Chair, and thank you for taking my question. So I understand how the funding would allow you to do extra data analysis, things of that nature. I'm just curious as to the mechanism of how the implementation would occur. I would assume that would be other agencies that would be doing implementing and not necessarily the board. So how would that funding be leveraged by this board? I'm not quite understanding how that would work.
Yeah, thank you for that question. My understanding is because the oversight of this committee sits in public health within the maternal and child health section, that the funding would come through the division and it would likely be put out through contracts in our state for the people who are doing the work at the community level, but with the direction and scope set by the committee's recommendations. You're welcome.
Other questions? Okay, I see none. So, thank you.
Thank you.
Okay, also signed up to testify is Lynn Charlotte and Pamela English from the NHCA-DSV, and I'll let you explain what those initials stand for.
When it goes off, it is the 3 minutes.
Oh, it isn't.
Am I on now? There we go.
You are on. You are
Good
on.
morning, Mr. Chairman, members of the committee. My name is Lynn Chalette. I'm the Executive Director of the New Hampshire Coalition Against Domestic and Sexual Violence, and I'm joined by Pamela English, our Administrative Director. I'm here to speak in opposition to House Bill 598. I want to be clear, we are not taking a position on the funding for the Maternal Mortality Review Board. We do, however, object to removing a stable source of funding for domestic violence services. The Domestic Violence Prevention Program was created by the legislature in 1981, establishing a guaranteed funding source for these services. The coalition where Pam and I work is the umbrella organization for the 12 community-based crisis centers in New Hampshire that serve approximately 15,000 victims of sexual and domestic violence every year. And one of those member programs is here to testify as well. This program, over the course of its life, has supported tens of thousands of victims. The DVPP is made up of several funds, as you've heard today, general funds being one of those. Those are important funds. They have also varied widely over the history of this program. If we went back about 10 years, pretty consistently the general funds were about $60,000. In the last 10 years, they have varied from a low of $2,000 to a high of well over $1 million. Another portion of this fund is the marriage licenses that we're discussing today. Sponsor Representative Edwards suggested that the connection between marriage and domestic violence is spurious. The data from our programs shows exactly the opposite. We collect data on the individuals that we serve. And according to statewide data over the last 5 years, 27% of the victims that our programs served were in spousal relationships or formerly spousal relationships. In fact, it's the highest relationship connector of all of the people that we serve. And just to give you a kind of national perspective, 30 other states utilize marriage license fees to support domestic violence programs. In New Hampshire, these fees bring in approximately $450,000 to $500,000 a year. However, what I really want to address today is the importance of continued stable funding for domestic violence services. Unfunded programs should never be the reasons that we don't serve a domestic violence victim in New Hampshire. And while we appreciate the sponsor's commitment to funding these life-saving programs, the alternative funding source proposed in this bill is inadequate and unstable for two specific reasons. As you've heard, the first way this bill would change the current funding structure is to increase the fine imposed under Joshua's Law on domestic violence convictions. Currently, Joshua's Law brings in on an average of about $42,000 a year, ranging from a low of approximately $38,000 to a high of about $55,000. Unfortunately, fines collected on convicted offenders are not a stable source of funding. The first reason for that is collecting and redistributing those fines is not a consistent practice.
Dave, if you could start wrapping up, please.
Okay. What we know about the collection of these fines from the New Hampshire courts is that they are often paid late. 40% of offenders do not pay on the day of conviction. 38% of offenders delay their payment, usually for an average of 6 months, and 24% of offenders never pay. The other issue is that quintupling the fine will not solve the problem. Currently, many offenders do not pay, and according to the Federal Reserve, more than 40% of the people in the United States do not have $400 in the bank to address an emergency. The collection rate of these will not improve. So, thank you. We encourage you to vote ITL on this bill.
Okay, thank you. Ms. English, would you like to testify, or are you here
Just
for?
take questions if you want to.
I'd be happy to take questions.
Okay, questions for these ladies? Yes. Ms. Hunt.
Thank you, Mr. Chair, and thank you for taking my question. So just to clarify, Representative Edwards testified that he would make sure that the funding gap would be plugged. Your concern then is not for this cycle, but down the road for subsequent cycles, because it would be tied into the general fund, and that's where your concern lies?
Our primary concern, thank you for the question, Representative, I appreciate it. Our primary concern is that general fund dollars fluctuate and fines that are assessed on convicted criminals are not collected consistently, universally, due to several factors. It's difficult to collect those fines, but often offenders don't have the money either. So just increasing the fine will not ensure a stable source of funding. Whereas the marriage license funding year after year is at a relatively level, so our programs can rely on those funds.
Representative Leon.
Thank you, Mr. Chairman, and thank you for being here today. I have a question for you about any correlation between offenders that are in a condition of non-payment and reoffending in future domestic violence situations. Mm-hmm. Is there a correlation, and is this something that we need to be digging in further, that this is just a canary?
Thank you for your question, Representative. Recidivism rates are very difficult to track for many reasons. So much of the pattern of abuse is often not reported to law enforcement, not prosecuted, as the sponsor noted earlier today. So it's very hard to know whether a fine, be it small or large, impacts an offender's behavior going forward. I think what we can most hope is that we fund prevention programs and try to stop that behavior before it occurs.
Follow-up?
As a follow-up, I wasn't asking about causation, I was asking about correlation. When you look at repeat offenders, is there a correlation between repeat offenders and non-repeat offenders and their payment status on prior fines?
Thank you for the question. I don't think we know that because of the difficulty in really collecting data on reoffenses or recidivism. I have not seen any research that suggests that.
Yes, Representative McKay.
Mr. Chairman, I can't tell exactly what position you're taking on this bill. Are you willing to tell us whether you support or oppose?
Thank you for your question, Representative McKay. We are not taking a position at all on funding maternal mortality.
Thank you very much. you very much.
Other questions? Yes, Representative Shapiro.
Thank you, Mr. Chair. Clearly, these are two very important programs, and it's unfortunate that we're in a discussion about them competing for funding. So, aside from the fact that you're saying the fines are less consistent, and also you mentioned that it was approximately $40,000 compared to $450,000. Do you have any ideas about what other funding mechanism for the domestic violence programs would leave you feeling more assured that they will be funded at a consistent on a consistent basis? I think that the representative has assured us that it will happen, and I trust that he feels that way and will do his best to do that, but we can't necessarily depend on one person saying that he'll make sure. So is there any other funding mechanism that you would see as being a consistent and stable funding mechanisms for the domestic violence programs?
Thank you for the question, Representative. Yes, the marriage license fees have been a reliable, stable source of funding, very consistent year to year to year. So our only ask with this bill is to keep that funding source intact. The general fund dollars, of course, are very valuable. You'll hear that from a program this afternoon. We're not here seeking a new funding source. We are simply asking not to take this one away.
Representative Weber.
Thank you, Mr. Chair, and thank you as a follow-up to that question. Would your concerns with this bill be eliminated if what we decided to do was eliminate Section 4, which is the special marriage officiant license part, which is what I think you are concerned about? Actually, it would be Section 3 and 4. And if we took Section 5 and had the extra fees paid directly into the Maternal Mortality Review Board, would that take away your concerns about this bill?
Thank you for the question, Representative Weber. I don't think it would, because to the points that some of you raised earlier today, the underlying use of these funds should be connected to the reason that they are collected in the first place. And they are collected because someone has been convicted beyond a reasonable doubt of a domestic violence crime. So I believe it's appropriate, should there be a change in the fee in the future, for that to stay in the DVPP.
Okay, so just to be very clear.
Follow-up, Representative Weber.
Follow-up, sorry. Making that change would not change your objection to this bill.
That's correct.
Thank you,
Representative.
Other questions for these ladies? Okay. Representative Merchant.
Thank you, Mr. Chairman, and also thank you for taking the question. I want to follow up on Representative Weber. Right now, $50 of the fine goes into the fund, and Representative Edward wants to increase that to $250. If we only took the $200 increase and put that into a fund, would that solve the issue as well?
Thank you for your question, Representative Merchant. I just want to clarify, are you asking if there was an increase and it went to the maternal mortality? Would that address our concerns?
Correct.
No, again, because these fines are assessed on convictions for domestic violence. Also, and you're going to hear this later from one of our member programs, we don't keep any of these dollars at the coalition. They pass directly through to the crisis centers, and they are used for direct reimbursement for out-of-pocket costs that victims incur as a result of domestic violence. So if the offender bashed a hole in someone's wall, or ripped the telephone out of the wall, or stole something, that is the kind of thing that these funds are used for. They're not even used to pay the salaries at the crisis centers. These are reimbursing tiny costs, car repairs, child care, a prescription that someone needs from an injury as a result of domestic violence.
Thank you. Other questions? Are there any other questions? Seeing none? Representative Leon.
Sorry, I apologize for this follow-up. I'm just curious, that seems like that would be a civil action to go after the offender in order to pay that restitution. Is that something that is not pursued by these groups in order to empower these women and make their lives whole?
So crisis centers would not be able to be a party related to restitution. As you know, restitution happens in a criminal case when there is a conviction. Courts infrequently order restitution, and it's also very difficult to collect. When it can be collected, that is wonderful, but that's a very small number of cases that ever happens in. Most of these cases are never in the criminal justice system.
Thank you. Other questions? Okay, seeing no other questions, thank you very much.
And I'll leave copies of our written testimony. Thank you, Mr. Chairman.
Thank you. And the last card I have for, in terms of someone signing up to testify, is from Shauna Foster from New Beginnings. You have 3 minutes, ma'am. Morning.
Good morning. My name is Shauna Foster, and I'm the Executive Director at New Beginnings, a local crisis center based in Laconia that serves over 600 survivors of domestic and sexual violence each year. I'm here today in opposition to House Bill 598, and I appreciate the opportunity to speak today. I have significant concerns about the impact that this bill would have on our organization's ability to meet the needs of victims and their families served throughout Belknap County. We see firsthand every day how important this funding is to our program. DVPP funds are used to provide essential direct services to victims of domestic violence. These include free and confidential 24-hour support, hospital accompaniment 24 hours a day, court accompaniment, safe shelter for victims and their families, transitional housing supports, one-to-one peer support, and support groups for all ages. The supports offered by our advocates stop serious physical abuse and save lives. It's important that we're able to maintain a stable, reliable source of funding to be able to continue meeting the needs of victims in our community. This bill jeopardizes that, and if passed, we would not receive the same level of funding that we currently receive under the existing system. I'm grateful for the legislature for being so supportive of our programs and our funding. Please vote no on this bill to ensure that we can continue to help those in need in our community. I'd be happy to answer any questions.
Okay, thank you. Questions? Questions from committee, Representative Leon.
Thank you, Mr. Chairman, and thank you not only for being here, but the important work that you do. And I apologize for not thanking the previous people for that as well. It's so important. My question is regarding the services for traumatized children, the operation of the helplines, and the trained and confidential advocates. Are those people that you contract with outside of your program, or is that part of your staff and part of the duties at New Beginnings in order to help these people in this time of need?
Those are part of our regular staff.
Thank you.
Yes.
Other questions? I see no other questions, so thank you very much.
Thank you.
Does anyone else wish to testify on House Bill 598? If not, then I am going to be closing the public hearing. I am hereby closing the public hearing on House Bill 598, and I am opening the public hearing on House Bill 264, and accordingly will recognize Representative Cannon, the prime sponsor, for her testimony, a member of our committee. Good morning, Representative Cannon.
Good morning, Mr. Chair, and to my fellow members on the Health and Human Services and Elderly Affairs Committee. This is my third term on this wonderful committee. Since 2005, there's been a law in the books to allow transgender people who've had a sex change to change their gender marker on their birth certificate. In the past 2 years, only 44 people were able to change their birth record information. Most of the people I know, my friends, my transgender community friends, most of them were born out of state. And for many of them, it was easy to go out of state to where they were born and change their information. Not so for people born in the state. Those that I know that are older, or like myself, or younger, for those that don't know, I'm 70 years old. So, and I knew I was a transgender person when I was 12 or 13. The folks that have been born in New Hampshire, as they've gone older, many of them have given up trying to get their birth records changed because it's, in many ways, the process is not clear. And we've even heard that there are some justices that will grant the gender change information, not fully understanding the amount of information that's required, and others won't grant that at all. Here in New Hampshire, and in many states, you can change the gender on your driver's license by checking a box. You can do the same thing with a passport for the federal government. I wish it were that easy to change the information on the birth record. You have to understand, you have to think about this. Your birth certificate usually sits in a drawer. You hardly ever use it. Possibly when you're young, or the first time you go for a passport, you have to bring your passport along, your birth certificate along, to prove where you were born and when you were born. They don't check the gender on the birth certificate for many of those. In fact, I don't know if the gender is really required on any of those, because a passport, for instance, requires a birth certificate to be submitted. And same thing for the initial driver's license or New Hampshire issued ID. I'm bringing this piece of legislation, as I've done a couple of times before, to simplify the process, to be consistent with other states, as well as consistent with how we get our IDs changed. To get the information required to change the gender in the birth certificate, an individual still has to get information from their physicians who are taking care of them. And in most cases, excuse me, in most cases, a transgender person will not only have their personal physician, they'll have a therapist, quite possibly a psychiatrist, not neurologist, but other folks that are responsible for their care. And the petitioner has to get information to submit for changing the birth record. That's the way it currently is, and that's the way this bill reads, is they will still have to get that information. That information was needed to provide to the court before. There is no form to fill out that asks for that information. Right now, it's sort of free form. The physicians are requested to essentially send a letter that an individual can bring to court. What I would like to see is that the current forms that are used in the Vital Records Office actually have a place to check off the box. I don't think it's been changed since I last reviewed it, but it doesn't even include anywhere on the form to say that the gender information is being changed for a transition. So why is it so important to change the information? It's simple in some cases. Simply being able to change an M to an F or an F to an M on this piece of paper might save a life, especially for youth and for young adults. They may not use this document for much except for what I've explained, but from a personal perspective, is to have this document reflect who they are, as well as if they've had a court-ordered name change, to update the birth record to reflect that. This is what I did in 2015, actually 2016. I had my birth record changed in Newton, Massachusetts, and I submitted a form at the time, the gender on my New Hampshire driver's license, and it had my physician's name, and it was notarized. And I took that to Massachusetts, and they accepted that information, and I was able to change my birth record on the spot in the Newton, Massachusetts City Hall. Here in New Hampshire, birth record changes need to be submitted in the town or city clerk's office, and it gets sent to Concord, where it's entered into the system, which is already currently done for especially the past 2 years, the 44 people that were able to change it. I mentioned the suicide rates of young adults and teenagers, older teenagers. In the transgender community, 82% of the transgender community have considered committing suicide, and 46% have attempted suicide. I'm one of those people. When I was in between my high school years and college years, I drank too much, and I drove while drunk and crashed a car. 2 years later, I did the same thing. I had been battling with my gender differences through junior high and high school. I was a mediocre student and very depressed, and found it very difficult. I was always also a very feminine kid, and I was bullied a lot in school. And I graduated high school at 118 pounds. I was a very petite person and very feminine. As I mentioned, I did have my name changed to Stratford County Courthouse in March of 2016. I immediately drove to Newton, Massachusetts, and had my birth record changed. Then I came back up to Portsmouth and had my Social Security information changed. And then I went to the DMV to change my license. Boy, was that difficult. I had to get additional information to change that license. Not because I was changing it, but because I had had a CDL before, and I had to cancel the CDL before I could get my driver's license information changed. It wasn't until I was 69 years old, last April, that I finally had my gender surgery. It was important enough even to that point to put my life on the line at a hospital to have that operation. I'm trying to save some lives here with this bill. It's as simple as that. In past years, I've had other reasons, but this is the most important one. Our youth, our transgender youth, are one of the highest groups of students and transgender people that consider suicide or have attempted suicide. I'm trying to save some life here. If we can get this through in its simplest form, it will change the gender marker from an M to F or F to M.
All right. Thank you, Representative.
Thank you.
Thank you very much. Yes, Representative Weber.
So just to confirm the process in a nutshell, isn't it true that what this bill does is simply remove the necessity and all the hoops that go along with a court proceeding to change your gender marker in the first instance, and then because of concerns we've heard in the past about people changing their mind or going back and forth or other concerns that may or may not actually be out there, it then requires, if there's a further change, that change must go to the court. Is that correct?
That is correct.
Thank you.
Representative McKay.
Thank you, Mr. Chairman. Would you believe how proud I am of your getting up in front of us today and telling us this, what is a painful presentation, but a fantastically positive area of leadership in the state. So I am extremely pleased to support you in your work, and particularly for those with mental illness and suicide. Thank you very much.
Thank you, Representative. Other questions? Yes, Representative Kofalt.
Thank you, Mr. Chairman, and thank you, Representative, for taking my question. Can you elaborate a little bit more? I'm concerned about this question of having to get rid of the CDL in order to get the license as you wanted it. Can you explain that in a little bit more detail, please?
I think it was more of a timing thing. I had gotten off the road in 2015, and I still had my CDL license. And I had decided at that point that I was retired from driving, and to stay as a valid CDL license, I was going to have to get another. Boy, getting old, you forget these terms. I was going to have to go to my doctor and get another physical. Just to maintain my CDL. So I decided at the time, as long as I was changing my birth record, my sex identifier on my driver's license, it was time for me to get rid of the CDL. And so I decided to get just a regular passenger vehicle license.
Okay.
A follow-up?
So if I'm understanding correctly, then this was not a case of anybody at the DMV or the state failing to follow proper procedures or enforce the law correctly?
They were following the proper
Okay, I
procedure.
just wanted to
And
clarify.
at the time, I didn't realize that I had to get additional information from my CDL and the reasons why I was not renewing the CDL.
Okay. Thank you for clarifying that.
Other questions? Yes, Representative Merchant.
Thank you for taking, Mr. Chairman, I'll second the question. So I want to be clear, you're not asking for, on line 22, to destroy the original. The original will always be retained. You're asking for it to be modified with a subsequent document.
That's correct. In all this, when I got my record changed in Massachusetts, that original document still exists in their file. So I did not put that in to this form. The current mechanism that's in place does not even require a marginal note, and that's a big thing for the transgender community. What does require a marginal note on changing a birth record is if you have a name change. So the name change could potentially be recorded on the birth certificate, but I believe in its current form, neither the name or gender information is a marginal note.
Okay, thank you. Representative Polozov.
Thank you, Mr. Chair, and thank you for taking my question. These issues around identities are very traumatic, and I would expect that some individuals, even after these changes, they would still be suicidal. So do you have any statistics or do you have any expectations if this bill go to effect? Like what would be percentage of prevented suicides, and what would be percentage of suicides unfortunately still happening?
I don't have any specifics. I do know that in talking with families with transgender youth, we're talking about young people between the ages of 14 and 18 who would require having a parent sign along with them as far as the information, required to change. And we have seen, and when I talk about, is that this little thing would help them recognize that the state recognizes them as having changed. It's also, as many parents have come to me, excuse me, sorry, I have asthma, and I need to use my inhaler, which is over there. So, I've had parents come to me and say, how do I get this done? Or can I get this done? And then I have to let them know what the process is. And many of them will follow up on it and bring their child to court with them and get things changed. But it is cumbersome on them as well. They have to go through the process, and they have to get physicians that will work with them to identify that the child is currently under their care, has identified as being the gender that they're living as for many years, and that they may be under the help of a therapist, a psychologist, their general physician. And in some cases, some procedures may have been performed or underway. They may be taking hormone blockers. For some women changing from female to male, they may have had some breast reduction surgery. I know of at least one case where the young lady had large breasts to the point where they had breast reduction that helped them in the process from a medical situation, that the weight on their chest was affecting their whole stature. So there are different reasons that people have undergone surgical procedures to move forward.
Okay, thank you. Other questions? Yes, Representative Shapiro.
Thank you, Mr. Chair, and thank you, Representative. Is under the system that we currently have, where a doctor has to write a letter, does that require that there have been some kind of medical procedures, whether it's hormone treatment or some kind of surgery, or is that up to the specific court?
Thank you for your question. Right now, it's up to the court to make the decision on whether has enough medical procedures, whether they be psychological or physical, changes have been done to make the change.
Follow up?
Follow up.
So as well as being a more difficult process for the person to complete, it's also a more subjective process where person might petition to have their gender marker changed, but not necessarily have it come to fruition.
That's correct. I've even heard of cases where the physician that had signed the documents was requested to come with the family to court to actually describe the situation.
Okay, thank you. Other questions? Yes, Representative Bill King.
Thank you, Representative Cannon, for coming and testifying today. I want to let you know that I deeply respect what you're doing coming forward. I'm sure this is very difficult for you. I do have a question. And it goes back to something Representative Polzoff had asked about the suicides. By removing this this bump in the road for somebody on their license, it gives them, I'm sure it gives them some type of security or confidence. But don't we still have a lot more to deal with? That this is just one small little factor, and that we have so much more to do with acceptance and the lack of bullying and things that you've experienced and others have experienced. Is that true?
Yes. There's a lot of work to be done. Society has a really hard time understanding what's going on as far as a transgender person goes. It's not something we just decide to do. It's really hard to explain. I have known since I was 13 years old that I was different. And back in the 1960s, there was no information, and I felt I was broken. I did not fit, and I hoped what was going on with me would go away. It never went away. I did get married. I thought it would go away then with physical relations. In a way, I personally think maybe that was a good thing at that time, because I have two wonderful daughters, and one's a senior bioscientist. So both my family has done well. I think most of my life I've felt that I've had to prove myself, so I've excelled in everything I've done. The toughest thing I have done is when I came out and decided to run for public office, because I was really concerned about how I would be perceived. I will be honest. I received a death threat on my first run for the school board in Somersworth. And sadly, I'm now a gun owner to protect myself. So it's a very difficult world for transgender people to live in. And we have some of the, especially in the black community, there's the highest death rate of transgender people.
Okay, thank you, Representative. Other questions? Yes.
Thank you, Chairman. The purpose of this bill, as you said, is to remove or reduce the number of deaths in the, and namely suicides, right?
Right.
And you also mentioned that there are other states that have already passed similar legislation, which makes it easier to change, right?
27 states.
27 states. Do you have any well-documented evidence that the number of suicides by transgenders previous to those bills being passed in their respective states has been reduced since the passing of these bills? Do you have any actual evidence to back that up?
I don't have specifics. I do know that I mentioned 82% of our transgender community have considered. That was a study that was done across the U.S. And 46% of the entire population have actually attempted suicide. So it's a substantial number of the entire population. I don't know of specifics in the individual states, but
Okay, thank you, Representative. Other questions? Okay, I see none, but thank you very much, Representative.
thank you for listening to me.
Also signed up to testify on House Bill 264, and I'm not sure the first name, so I apologize. Ms. Precock, I believe it is, from the Secretary of State and the Division of Vital Records. And you put information only on your card. Does that mean you don't want questions after, or? I wasn't sure what you meant by that.
No, I'll be happy to answer questions after. It's just an informational. So good morning, Mr. Chairman and honorable committee members. My name is Patricia Pietsu. I am currently the acting state registrar for the Division of Vital Records. And the Secretary of State's office has no position on this bill. Prior to becoming to the Secretary of State's office, a matter of fact, I was a city clerk, and I did work with Representative Cannon on this bill a few years ago, so I think she'll remember me on that. The only thing that I wanted to bring into your attention that in replacing 5C87 with this bill is that you are removing the option for somebody that does have a certified court order that has gone through the gender reassignment surgery to be able to submit that. So that's the only thing we wanted to bring to your attention. They would still then be able to still have their physician sign off on the form that will be provided by the Division of Vital Records and everything like that, but it'll be a committee decision as to whether or not they would want to still be allowed to add that court order for somebody that may have gone through that gender reassignment surgery. But otherwise than that, again, it's the committee's decision as to what you want to do, is whether or not to allow that, because the court order normally would then remove the legal name change that was brought up before from the marginal note, whereas because in 5C 87-4, if there is a legal name change on there, the AKA would have to remain on the birth certificate under the marginal note. But that's all I have before you. If you have any questions, I'd be more than happy to answer them for you.
Okay, questions? Representative Leon.
Thank you, Mr. Chairman, and thank you for being here today. I have a question for you about the use of birth certificates, where they're used, if that's used in the process of determinations for incarceration or anything else. I'm just trying to understand where outside of our normal record keeping birth certificates are used.
So birth certificate is used for many things. As Representative Cannon mentioned, you need your birth certificate for your passport. A lot of jobs now require you to have your birth certificate. Children need their birth certificate in order to get into school, for sports, for when it comes time to retirement, Social Security. So there are many other different places where the birth certificate need to be utilized.
Sorry, as a follow-up, is that used in the case of incarceration, or is that just looked at through other metrics? The
As far
driver's
as,
license.
I don't know what is required as far as incarcerations goes. I know that we have at times received requests from those that are currently in prison or maybe in the House of Corrections who require a birth certificate. So we do receive them, but can't say how often.
Okay, thank you. That's just a larger, more complicated question. I just wanted to make sure we were addressing it. Thank you.
Other questions? Yes, Representative.
Thank you, Mr. Chair, and thank you for taking my question. So, we did receive testimony, if I understood it correctly, that the process in New Hampshire is a little bit more Byzantine than the process in maybe some other states, and you have to go through a court process. So when you look at the process in New Hampshire versus the more streamlined and I would say potentially lenient process in other states, do you see any other concerns that have been generated in these other states by going to this more streamlined process?
Well, Representative McLean, thanks for the question. I've been in this position for only 2 months, so I can't really speak to the other states. I know that currently the court order is currently required for us, but I think Representative Cannon had some good testimony as to what is happening in other states.
Thank you.
You're welcome.
Other questions? I see no other questions. Thank you very much.
Thank you all very much.
Also signed up to testify is Representative James Rosner. Good morning. You indicate you'd like 4 minutes. I'd prefer if you could keep it as close to 3 as possible.
Good morning, Chair and Committee. My name is Representative James Rosner, and I'm here speaking as a transgender man. I came out and began my transition about 7 years ago, and in that time, my lack of sex change has not hindered my life as a man in any way other than through trivial legal filings and insurance misunderstandings. I changed my name and gender marker on my driver's license and on other personal documents at the same time because if you're not familiar, changing your legal identification twice in a row is a big pain. So I intentionally did them all at the same time. I am not, however, able to update my birth certificate with confidence because I have not completed a sex change or what would be generally interpreted as gender confirmation surgery or bottom surgery or a genital reconstructive surgery. I had come to accept that having an accurate legal birth record is just not a right that I have as a trans person. I'm no longer able to use my birth certificate as a secondary means of personal identification without it becoming an ordeal. I can only imagine how difficult that will be when that presents itself if I am not able to correct that in a timely manner. My greatest concern with the current sex change requirement for updating birth records is that it mandates an invasive and personal surgical experience for all transgender people who want to be recognized legally. Especially in the wake of so much social fear and confusion around gender transition, exceptionally so around gender dysphoric children, I find it disproportionately counterproductive for the state to require that we must undergo an intimate, irreversible, and extensive surgical procedure to be recognized correctly as a transgender person in our documents. Mandates such as this only serve to pressure transgender individuals to undergo gender-affirming surgeries that do not contribute to their quality of life, because transgender happiness and self-comfort is not contingent on going under the knife to better replicate our bodies to look cisgender or non-transgender. That isn't to say that these aren't necessary, but that transition is a very personal and specialized procedure and lists of happenings and changes that each individual decides for themselves. It's not a one-size-fits-all blueprint. Not everybody needs everything to happen. As I stated, I have been living as a man for 7 years, and I knew my entire life that I would rather live as a man. Despite all of this, it's my personal decision with my body that I do not require a reconstructive genital surgery, especially at its price of time, money, pain, and risk. That is not to say that these services are not completely necessary for other individuals, and I hope that testimony will continue to contribute to that understanding and knowledge. But it is counterproductive to assert that this, of all things, is what constitutes my ability to be socially and legally recognized as a male. And I also wanted to add, that was the end of my testimony. I did, while we were listening to our introduction, look up some statistics on transgender legislation, when that is proposed, and how that affects suicidality, especially in minors. Recently, the Trevor Project in Texas reported that there was a 150% increase in calls from Texas youth when the transgender threat was introduced to the Texas State House last year. There are many other links and studies that I can send over, but I don't want to take up any more time here.
Okay, thank you very much. Questions? Any questions for the representative? Okay, well, thank you very much.
Thank you.
Also signed up to speak this morning is Abby Maxwell.
Morning. My name is Abby Maxwell. I live in Concord, and I am here in support of HB 264. My daughter is 10 years old. When she was born, we thought she was a boy. She spent her toddler years insisting to us that she was a girl, and she spent kindergarten and first grade saying that she did not want to exist if we kept making her be a boy. At that time, my husband and I could not even define the word transgender. However, we finally sought medical care in the form of a psychologist at one of the best children's hospitals on the East Coast. And we learned what it means to be transgender and how to support our child so that she could have a happy, healthy life. We gave her dresses, allowed her to change her name and pronouns, and watched as a light came on inside our child literally overnight. Now, my daughter has been living happily in her true gender for nearly half her life. She even has a U.S. passport issued under the Trump administration with the correct gender marker. Yet at school, she has an IEP, and because of New Hampshire's birth certificate laws, her gender is listed as male on the very first page. Her teachers and vice principal have worked hard to get this corrected because it's inaccurate, it's an invasion of her privacy, and it also opens the door to possible bullying and discrimination. However, because of the laws, the school has been unsuccessful in making the correction. School is not the only place where this comes up. Every time I sign my daughter up for a day camp that requires a complete vaccination history, as many do, I also have to out her, as the wrong gender appears at the top of the page. When I check her in at the doctor's or the dentist, the receptionist still sees M rather than F. My daughter, like all of us, has a right to her privacy. She should not need to explain what it means to be transgender when she just wants to join art or music camp. It is already difficult enough for our family to exist in a country and state where our daughter's right to simply be herself is constantly debated on a public stage. This small change in New Hampshire law would harm no one, and it would make her life and ours just a little easier and, more importantly, safer. Thank you for your time.
Okay, thank you. Questions? Any questions? Okay, I see none. Thank you very much. Also signed up to testify is Erica Perez from the New Hampshire Youth Movement.
Good morning, members of the committee. My name is Erica Perez. I'm from Manchester, New Hampshire, and I'm here today in support of HB 264, representing the New Hampshire Youth Movement. Before I saw this bill, I was unaware that in order to change your sex marker on your birth certificate in New Hampshire, you must first, according to RSA 5C87, have undergone what's referred to as a sex change. Right now on GoFundMe, there are over 500 pages of people seeking help to pay for their top surgeries. Trans people everywhere, but also in our own communities, already struggle with finding things like safe and secure housing and job security. These surgeries that the state has made a requirement of changing your sex marker cost thousands of dollars and create just one more barrier for the trans community in our state to have to jump through. Having surgery doesn't make you any more or less trans, especially when it's not a financial decision everyone can make. This bill would make it so a notarized letter from your doctor would be enough to start the process of changing your gender marker, and frankly, I think that should be enough. I would also like you to consider creating an amendment to add an option for an X gender marker to include intersex people, non-binary people, and other people who do not feel aligned with an M or an F. So again, please vote ought to pass on HB 264, and thank you for listening.
Okay, thank you. Questions from committee members? Okay, I see none. Thank you. Also signed up to speak this morning is Courtney Reed from the ACLU of New Hampshire. Is Ms. Reed here? Oh, there she is. Good morning. You have 3 minutes.
Thank you, Chair McDonald. I've just handed around a copy of my testimony, as well as a copy of a academic article relating to the mental health benefits for trans individuals who have access to change the gender markers on birth certificates and other IDs. I think that this could serve to bolster some of the emotional testimony we've heard earlier this morning. So I would just like to provide a brief statement of support for HB 264 and encourage all members of the committee to review the article that's going around, which I reference in my testimony. HB 264 is a bill that allows gender-affirming corrections to individuals' birth certificates, which is a crucial part of one's gender transition and is foundational in ensuring individuals with historically marginalized gender identities can navigate institutions and legal systems which often require consistency and documentation, which we've heard in some of the stories earlier today. Presently, the state of New Hampshire only allows individuals to change their identification their gender identification on birth certificates with a court order, and HB 264 would reduce the burden for individuals wishing to make this change by enabling the change of gender markers instead through a notarized certificate provided by a healthcare provider. Passing HB 264 would put New Hampshire on track with its peer states in New England, most of which also require only a certification from a healthcare provider, and would remove the present and unnecessarily taxing process from the courts and reduce this burden for transgender individuals as well. I also encourage members of the committee to consider the basic safety and well-being of trans individuals as it relates to this bill. When a trans person is forced to show an ID document that doesn't match who they are, they can often face discrimination or even violence. This has been documented by the National Transgender Discrimination Survey, where it was found 40% of respondents with IDs that did not match their gender identity experienced harassment. Medical and mental health professionals have long recognized the importance of updated identity documents as a part of gender transition. Research from studies conducted in Massachusetts and Rhode Island, the one I'm passing around, where the process of changing one's gender identity marker is relatively easy compared to the state of New Hampshire, found that legal gender marker and name change was associated with lower negative emotional response to gender-based mistreatment and improved mental health outcomes among trans populations. Improving access to official documents that correctly represent one's gender identity is a matter of dignity, and laws that make the process of amending and correcting essential identification documents unequally burdensome for trans individuals only functions to further marginalize this community. A simple change to this process via passing HB 264 would enable Granite Staters to better control how their gender is expressed, and for that reason, the ACLU of New Hampshire requests the committee vote ought to pass on HB 264. Thank you.
Questions from the committee? Yes, Representative Nagel.
Thank you, Mr. Chairman. We have a question about the court process right now. We've heard implied or stated a couple times that that would require a surgical change for the court to issue that order. I'm looking at law here and I don't see that. What criteria does the court use now to initiate that order?
Yeah, thank you for your question. From my understanding, I don't believe a surgery is required, but I can get back to you on that, and I believe other individuals providing testimony would be able to answer that question more appropriately. Thank you.
Can I have a
follow-up?
Is there any place in law where it states what criteria the court needs to use?
I could get back to you on that.
Okay, thank you.
Thank you.
Okay. Other questions? Representative Leon.
Thank you, Mr. Chairman, and thank you for being here. Thank you for providing this study. Just taking a quick look at the abstract and the methodologies. It says that it's actually evaluating it based upon whether they've legally changed their name on their passport or driver's license. And I'm under the impression that we already have that in New Hampshire. And this bill is dealing with the birth certificate, which is an important but different document. Could you clarify that for me, please?
That's correct. I couldn't find a study relating to birth certificates, but I think we could classify birth certificates as being another essential document related to functioning in legal systems and gender identity affirmation.
Thank you.
Thank you.
Other questions? Okay, seeing none, thank you very much.
Thank you.
Also signed up to testify this morning is Sam Hawkins from NAMI, New Hampshire.
Good morning. Thank you, Mr. Chair, and to the committee for the opportunity to testify today. My name is Sam Hawkins, and I'm the Public Policy Assistant at NAMI New Hampshire, the National Alliance on Mental Illness. NAMI New Hampshire is a nonprofit grassroots organization whose mission is to improve the lives of all people impacted by mental illness and suicide through support, education, and advocacy. On behalf of NAMI New Hampshire, I'm here today to speak in support of HB 264. There's an emerging body of research that shows that LGBTQ individuals, especially those who are transgender or gender nonconforming, are at an elevated risk for experiencing anxiety and depression and are more likely to consider and attempt suicide than their heterosexual or cisgender peers. I've passed around a study from the Trevor Project relevant to New Hampshire LGBTQ youth ages 13 to 24 in 2022. And that showed that 39% of LGBTQ youth in New Hampshire seriously considered suicide last year, and 10% attempted it. Beyond New Hampshire, as you heard from Representative Cannon, a 2020 study in the Journal of Interpersonal Violence found that 82% of transgender individuals across the US and Canada have considered suicide, and 40% have attempted it. Hormone therapy and gender-affirming surgery alone can significantly decrease the likelihood of psychological distress, but in addition, trans mental health must be addressed socially within our communities. The Journal of Interpersonal Violence study found that school belonging, internalized stigma, and emotional familial neglect made a significant contribution to suicidality for transgender individuals. Based on this data, we believe that access to identity-affirming spaces is one of the most significant ways we can promote trans well-being. You can see in that Trevor Project report that open representation and a welcoming environment have been identified as qualities that make a space affirming for LGBTQ youth. Yet in New Hampshire, these spaces are few and far between, as evidenced by the fact that only 18% of LGBTQ youth believe the community to be, quote, very accepting. By allowing for amendments to birth records more easily, this bill would take an important step in making New Hampshire at large a supportive environment for transgender individuals, better enabling them to obtain an affirmative legal recognition of their identity from the state. We believe that this and similar efforts will help to improve the mental well-being of transgender individuals and decrease the prevalence of anxiety, depression, and suicide within the community. For these reasons, we urge you to vote ought to pass for HB 264.
Okay, thank you. Questions? Does anyone have any questions of this individual? Yes, Representative Polazov.
Thank you, Mr. Chair. Thank you for taking my question. I want to ask you about page 6. So there is a graph that shows that for about 5-year period from age 13 to 17, comparing to about 7 years from 18 to 24, and a shorter period has actually like larger representation of 60%. So does this graph mean that issues with transgender for some reason are happening twice as often as they were in a little bit older kids?
I'm sorry, could you restate your question?
So there is a graph called Age of LGBTQ Youth, and it says that youth from 13 to 17 has 60% of prevalence.
So 60% of the people in the study versus 40%.
Okay, I'm withdrawing my question. Thank you.
Oh, okay, thank you. Other questions? Representative Leon.
Thank you, Mr. Chairman, and thank you for being here and taking the question. Just looking at these different issues like school belonging, the internalized stigma, do you believe that a change in these documents will change access to different spaces, or is this simply just more of a welcoming, accepting atmosphere, in your view?
Thank you for your question. I believe it's both. I believe better enabling people within the state to having the state on their side in getting these documents and better enabling them would give a community sense of belonging and acceptance within their identity. We have also heard testimony that there are situations where you're required to present a document and there are safety concerns for transgender individuals that if their identity is not represented in those documents, they could be exposed to violence. So I think it's both.
Thank you.
Okay. Other questions? Okay, I see none, so thank you very much.
Thank you.
Also signed up to testify this morning is Bill Bloom.
Good morning, everyone. My name is Bill Blum. I currently live in Atkinson, New Hampshire. I am a transgender, non-binary individual. My journey started at a young age. When I was a teenager, I realized I was, to quote Lady Gaga, born this way. I was not living a genuine life. At the time, I was afraid to tell my story. I lived in an unsupported area and just kept quiet. I got married, moved to Portsmouth, New Hampshire, really started coming out of my shell, if you will, really started exploring. That led to the timeline. In May of 2022, I walked into the DMV in Dover and changed my gender to non-binary when I renewed my license. In September of 2022, I was fired from my job without cause. There was no supporting paperwork. They simply eliminated my position. In January of 2023, on the first Monday of last month, I moved out of my home. And in February, this month, in less than 2 weeks, I am starting the mediation process to go through a divorce. Why am I telling you this story? I'm telling you the story to tell you the story about transgendered individuals. Being transgendered, yes, is a noun as a definition, but to me it's a verb. It's an action that I am taking. I am on a journey. Where does that journey end? I'm not sure. Does that journey end going all the way to the female side of things? Does that journey end going to getting onto hormones? Does that journey end with sexual reassignment surgery? That last option is not applicable to me or available to me right now because I am also still unemployed. In the professional world, I've used to document, I onboarded people for a job. I hired over 50 people, and thus processed I-9s. You simply needed a driver's license and a passport. If you didn't have that, birth certificate worked too. The state of New Hampshire recognizes that there is its ability to change your driver's license is pretty cut and dry. The ability to change your passport's not the federal government. That's pretty cut and dry. As a data person, I find it challenging that all of the documentation is not in the same regards as far as the process. If I want to end my transition by fully having all my paperwork reflect my true gender, I don't feel that there should be any roadblocks financially or otherwise that will get in the way. To speak about the question about mental health issues within the transgender community, yes, this bill might not prevent all suicides. If we simply do nothing, we're not going to prevent anything. But if we make this change, this might make just one person complete and whole, because I truly believe in living a whole and truthful and genuine life, and at what cost to me doesn't matter at this point. I've already lost a lot. Thank you for your time.
Thank you. Are you taking questions, or are you all set? Okay, thank you. Also signed up to testify this morning is Chris Urchel from the LGBTQ legal, who's an LGBTQ legal advocate and defender.
Thank you, Chair. My name is Chris Urchel. I'm an attorney at GLBTQ Legal Advocates and Defenders. I'm a New Hampshire licensed attorney. I work in Boston mostly, but I do a lot of work here in New Hampshire, including legislative work and litigation. And I've assisted people in obtaining orders to correct their birth certificates in New Hampshire, and I'm here in support of the bill. So there's a lot of confusion about the process that currently exists, and I think we've heard some of that today. I want to be clear that what is proposed in the bill is not a change in the standard of what's required to obtain a new birth certificate. All that's changed is all that's changing if this bill becomes law is a change to the process. It's more efficient and it's less wasteful. Just to say that I have never heard of a person being able to obtain one of these court orders without hiring a lawyer. I've never heard, I mean, and of course, you know, every time you go to the court, it requires, you know, administrative costs with the court, filing a petition, et cetera, asking a judge to take time out of that judge's day to make an assessment of something that the judge typically isn't really equipped to assess anyway. So of course the judge is relying on what the doctors say, and which is what the bill would do. And so it's just an administrative nightmare that doesn't have to happen, to go to courts, use court resources, et cetera, to obtain this petition, and it's expensive. Also, it creates a lot of problems for people, especially people who are born in other states but need to obtain, born in New Hampshire but live in other states and need to obtain a court order from their home, where the court is like, well, we don't have that requirement in our state, so we don't know we don't know what we're supposed to do. And so it creates yet another set of obstacles, whereas if there were administrative process in New Hampshire, that person wouldn't have to go to their home state's court system to try to get an order to deal with it. I want to speak to something that Rep. Leon has asked about what birth certificates mean in terms of access to sex-separated facilities in different and programs in different contexts. And no New Hampshire state government related program or activity relies exclusively on birth certificates to determine placement for, and that's true, the New Hampshire Interscholastic Athletics Association does not even mention birth certificates in its standards, and the DOC would probably view a birth certificate as strong evidence of where someone should be placed, but there is absolutely no place where anyone relies exclusively on what is on a birth certificate or a driver's license, for that matter. On the other hand, private facilities, private institutions have the right to make their own determinations about how they would divide people into sex categories based on documentation. So that I hope that answers that question. The language that's in the current statute is outdated, and it leads to confusion, as you've heard today. I don't think any judge in New Hampshire today in the probate courts requires any kind of surgical procedure or even proof of any other medical procedure or treatment. Instead, they require a letter from a doctor that says that somebody has completed transition to the gender that they're, asking to be identified as. And so, fortunately, judges are consistent in New Hampshire. Judges are great in New Hampshire, as you probably already know. The problem is that there's a lot of confusion, that people don't necessarily understand what the standard is, and then even to go and access that standard, you got to hire a lawyer. You got to pay to file a petition in equity in the court. It is just it's just very taxing. A lot of people don't even know.
If you could begin wrapping up, sir.
Sure. Okay. So the one thing that I want to also note is that the fiscal note, it's for the fiscal note speaks to a process that already exists. People can change their birth records through the court order system. I'm not quite sure what it is. I don't want to question what Vital Records is asking for in the fiscal note, but I would ask that if they are updating their software, I think that it would be prudent for them to also accommodate other markers besides MNF. And I'm happy to take questions.
Thank you. Question, yes, Representative Nagel.
Thank you, Mr. Chairman. Thank you for your testimony.
Yeah.
I have two questions. I'm frustrated by that you would need an attorney for this, but what is the cost to an individual to go through this process? And secondarily, what's the time frame?
Yeah, that's a good question. So I believe, and you can't quote me on this, I believe that the full cost to file a petition in equity is somewhere around $300. The cost to file a name change petition is much less, and judges will typically allow you, if you're in the know, they'll allow you to, tack on a motion onto that petition without filing a whole new petition. So the cost could be relatively low. You can also get indigency waivers if you can't afford to pay the cost, but again, you have to know that that's an option available to you. And many attorneys will do this work for free. Other attorneys will do this work for a fee, and that varies from person to person. The time, if everything goes really, really smoothly, I think you can get the whole thing done in about a month. But that's I've seen it take many months and multiple court visits because someone will come to court with having a letter where the wording is unclear to the judge, and so the judge says, "Can you ask your doctor to get a more direct letter?" And then you go and you get it, and then that just adds another month to the whole process. So that's typically what I see. Does that answer your question? Thank you.
Other questions? Representative Merchant.
Thank you, Mr. Chairman. Also, thank you for taking my question. So, a citizen of New Hampshire who was born in another state, because this came up with the Department of Corrections, DLC. So if I was born in Mass, but I now reside in New Hampshire, become incarcerated, there's nothing to prevent me from going back to Mass where my birth certificate can be changed. Well, this is only talking about people born in New Hampshire.
So yeah,
in
earlier,
other words, if I'm, help me understand, you go back to the state in which you were born to change your birth certificate, correct?
Mm-hmm.
Not the state in which you reside.
Well, you're right. It's the Vital Records Department, typically in a state that issues a birth certificate, and they would allow you to be where you go to change it. Right?
Follow up, Mr. Chair.
A follow-up, sure.
So what I'm trying to understand is if I was born in the state of Massachusetts, but I reside in New Hampshire, I can go back to Mass and change my birth certificate using the form within Mass. So therefore, if I'm incarcerated, going back to the DLC, it's going to go back to the birth certificate that I have in Massachusetts, not how I stand within New Hampshire.
So just to clarify, if I understand your question correctly, a person who is formerly incarcerated in New Hampshire can get a birth certificate without going through any court process in Massachusetts that changes the gender marker on that birth certificate as long as they were born in Massachusetts. And that's true. That's true regardless of this bill, of course. But yes, it's true. To change your name, though, on a birth certificate or to get a legal name change in Massachusetts or in New Hampshire, you will still need to go through a court process that evaluates for things to make sure there's no improper purpose. For changing your name, so that a transgender person who is formerly incarcerated will have to demonstrate that, no, I'm not doing this because I want to hide my identity. I'm doing this because I, want to reflect who I am.
Other questions? Yes.
Thank you, Mr. Chair. I have two quick questions with your indulgence.
Sure, go ahead.
Thank you. So my first question, you clarified that this is a matter of process, not the standard. And I think it might make sense to have harmonized documents. I'm just kind of wondering, from a history perspective, why in 2005, when we created this initial process, was the birth certificate differentiated from these other documents in terms of having to go through the court process? Why was that kind of set apart?
That's a really good question. Unfortunately, I can only speculate because I've only been doing this work for 4 years and not 20 years. But my understanding is that vital records departments are often really hesitant to adopt any kind of changes to birth records because of the importance that those administrations place on what a record actually represents. Today, I think that there's a much better understanding among vital records departments across the country, and I don't mean to speak for vital records here, but that databases are actually where information is stored, and that and this bill does nothing to change how vital records stores information, and that a piece of paper is really a piece of documentation that someone uses to navigate tricky situations in life. Does that answer your question?
Yes, thank you. And my second question, just quickly, unfortunately, the lady from the Secretary of State's office had only been here 2 months. So I'm just trying to understand. It seems like a lot of other states have gone to this more streamlined process, and I'm just trying to get a feel. Has it been a smooth process, or have there been any observed consequences from that might want to be explored?
Yeah, so there's one consequence which I kind of alluded to earlier, which is that when you reside in Massachusetts right now, but you were born in New Hampshire, trying to convince the Massachusetts courts that they have to issue a court order when they don't see these with any regularity is really perplexing for them, and you have to really go in and convince a judge that so that's one downside that can arise from it, so if someone say Ohio requires court orders. If somebody was born in Ohio but lives in New Hampshire, the courts, if the law were to change, the courts might be like, "Ooh, we don't know if we can do this," and then, it might be a little bit extra work to try to convince the judge that, the judge does in fact have power to issue this order for the Ohio vital records. That's what I see as the major downside.
Thank you, Representative Leon.
Thank you. This is actually just a quick question. Could you email me your testimony? We ran out of copies, and I would love to have one.
Oh yeah, I have an extra copy for you if you're the only
Perfect.
one who doesn't have
I'll
it.
take it.
And also I did email it this morning, so okay. Is that
Okay, sure. Any other questions? See no other questions. Thank you very much. The final person who had signed up to testify this morning is Linz Jackhouse from 603 Equity, or Equality, I'm sorry.
Thank you, Mr. Chairman. My name is Linz Jakehouse, and I live in Dover. I am a founder of 603 Equality, which is pursuing nonprofit status as a statewide LGBTQ plus organization. I am non-binary and use they, them pronouns, and I strongly support HB 254. As was mentioned, birth certificates serve as proof of an individual's age, citizenship status, and identity, and are often necessary to obtain a social security number, apply for a passport, enroll in schools, get a driver's license, and apply for other benefits, including health insurance. Being forced to show a birth certificate that outs a person as trans can be a barrier to all those opportunities. It can trigger dysphoria, the significant distress caused by misalignment of a trans person's gender and how that person is seen or treated. In some cases, being forced to reveal a trans identity can open up people to discrimination or violence. I've recently spoken to a Health Market Connect navigator who may have emailed you testimony, who specifically helps LGBTQ people get health insurance through the exchange, Medicare, or Medicaid, who really hates that she has to ask trans people for the gender marker on their birth certificate and open themselves up that way. She sees the fear and discomfort in their eyes, even though, of course, she's going to help them no matter what. Like everyone, trans people face many different factors that impact our mental health. We may not be able to arrive at an exact percentage of trans suicides averted if this bill were to pass, but it's easy to see how this gender affirmation is one factor that will benefit trans people's mental health and well-being. Currently, as Chris Urschel explained, the process can be really time-consuming, involving taking time off work, and even more time if someone, for example, files a name change petition before the gender marker petition, causing the name change petition to be reopened. And please support streamlining this process and extend dignity and respect to transgender people by voting ought to pass on HB 254. Thank you.
264, actually.
264, even better.
We know what you mean. Okay, thank you. Any questions? Yes, Representative.
Thank you, Mr. Chair. Thank you for taking my question. So as a person who identifies as they, them, non-binary, what does this look like for you then?
So I would like to see a bill that allows people to update a birth certificate to an X at some point. I understand, the intention was to pass a more binary bill first. Or I updated my gender marker on my driver's license when that became possible in 2019. So I have an X gender marker on my driver's license. I do not have an X gender marker on my birth certificate since that's not possible. But I hope that for someday it was really affirming for me to have a document that shows my gender as I understand it. And many people would like to do the same with birth certificates and make X a possibility on a birth certificate. So I would like to see a bill maybe next year that builds on that.
Okay. All set? Did you want to follow up? Or?
Yeah, you can follow up. Happy to.
Thank you. Well, yeah, it's just, so if this goes through, are we just in next year doing this again to extend what things we want our birth certificates to, what we would be able to do with our birth certificates, and to what extent can people change other things besides sex on their birth certificates? Like, is that coming?
I've never heard anybody, make a case for changing anything other than a gender marker on a birth certificate. So I'm not sure or what else would be involved, but I would definitely like to. I don't necessarily feel a personal need myself to change my gender marker on my birth certificate, but I definitely want that opportunity for other people that would feel affirmed by that.
Okay. Thank you. Other questions? Any other questions? Okay, I see none. Thank you very much.
Thank you.
I know of no one else who has signed up to testify. Is there anyone here who does wish to testify on HB 264? Seeing none, I am going to close the public hearing on House Bill 264 and open the public hearing on House Bill 566. and represent the prime sponsor, Representative Germana. Okay. Good morning.
Good morning, Mr. Chairman. I'd like to thank you and members of the committee for this opportunity to speak with you. My name is Nick Germana. I'm a representative from Keene, Cheshire 1. I have passed around on one side a written copy of my testimony, and on the other side a letter to the committee that was written by a child care provider in my district who was not able to be here today. I'm here to speak in favor of HB 566 FNA. And again, I thank you for hearing my testimony. The purpose of the bill, as you can see, is to create a child care workforce development fund to administer signing and retention bonuses to child care workers in New Hampshire. We are all well aware of the dramatic shortage of child care workers in the state, with well-documented consequences for the economic well-being of Granite State families and communities. Governor Sununu has listed addressing this shortage as one of his top priorities for this biennium, and Speaker Packard, as we know, has created the Special House Committee to explore productive bipartisan solutions. When we talk about the issues facing our state around child care, we talk about affordability and accessibility. All too often, however, these two desirables are at odds with each other. Achieving the goal of affordability requires that we keep the cost of child care down, ideally at 7% of a family's income or less. The way this is usually achieved is by paying low wages to the women and men who deliver this vital service. In my region of the state, the average preschool educator enters the field making $13.51 an hour, and an experienced early childhood educator makes on average $17.51 an hour. This works out to $28,000 a year and just over $36,000 a year, respectively, in a state where the average cost of living is around $52,000 as of December 2021, no doubt considerably higher now. To give you a more personal example, my wife has been working in the field as an early childhood educator for more than 25 years, and she has 2 college degrees, an associate's in early childhood development and a bachelor's in developmental psychology. She recently became a co-director of a center in Brattleboro, and for the first time in her career, she is making just over $40,000. 25 years of working in the profession with 2 college degrees, and she's still earning less than $10,000 a year than the average cost of living in this state. Our 19-year-old son, who has taken time off from college to learn business from the inside, is currently the manager of the Jersey Mike's restaurant in Manchester. I highly recommend it. And last year, he made almost twice as much as his mother. We certainly don't begrudge him that pay. Frankly, I'm really happy he can pay his own bills. He works extremely hard and has proven himself to be immensely valuable to his employers. But what does this say about how much we value the people who help nurture our children and keep them safe every day? The people who comfort them when we cannot and prepare them for the academic and emotional challenges of the early school years. As important, what does this mean for the future economic vitality of New Hampshire families and communities? As you will read in the online testimony and hear from in-person testimony, the child care workforce shortage in our state has a serious economic impact. Many Granite Staters, the overwhelming majority of whom are women, have either involuntarily left the workforce to take care of children because of the lack of accessible, affordable child care options, or are forced to work fewer hours than they would like. The research done for SB 446 from the last session of the legislature cites the New Hampshire Economic and Labor Market Information Bureau estimates that a 1.3% increase in workforce participation by women between the ages of 25 and 54, made possible by an increase in availability of child care, would yield an additional $1 billion for New Hampshire's GDP. In early February 2021, the National Center for Children in Poverty identified the lack of affordable and accessible child care as one of the central constraints of the development of New Hampshire's workforce coming out of the economic downturn associated with the COVID-19 pandemic. And just last month, the Business and Industry Association wrote that one of the most pressing problems impeding businesses' ability to recruit and retain a workforce is the lack of accessible and affordable child care. Without access to quality, affordable child care for their workers, businesses are unable to fill critical vacancies, which limits opportunities for growth and stifles their potential for economic success. This is not a partisan issue, as we all know. Across the country and here in New Hampshire, we have people on both sides of the aisle working together to find solutions. At least 6 other states with Democratic and Republican legislatures and governors have signing and retention bonuses for child care workers, including Alabama, Connecticut, Illinois, Iowa, Kansas, and New Jersey. Here in New Hampshire, we have implemented signing and retention bonuses for critically important state government jobs. Why would we not do the same for child care workers who are essential to the financial well-being and future of our families and communities? Building this vital workforce means compensating the workers and treating them like the professionals they are, and HB 566 provides one path for moving in that direction, or in the direction of a productive public-private partnership without increasing the financial burden on families. Thank you for your time and consideration, and I'm happy to answer any questions.
Thank you, Representative. Questions? Representative Nagel.
Thank you, Mr. Chairman. Thank you for taking my question. I'm curious, do you have data about the turnover rate for employees? And you've specified between child care worker and child care educator.
Yes.
I'm impressed your wife stayed in the field that long. But what's the turnover rate? Because that'll have a huge effect on this bonus structure here.
I do not have that information. We have some providers here today who will give you some, I think, good concrete answers to that question.
Thanks. Thank you.
All set. Representative McLean.
Thank you, Mr. Chair. And thank you for taking my question. While I agree that child care issues is very important and certainly increasing the workforce participation would be huge, just looking at how this is structured, once you're into it, it looks like you're giving a $3,000 bonus every 5th year. And so I'm just wondering how that was arrived at, because I really question its ability to really do what it's promising to do in terms of being able to retain someone. Based on what you're describing about your wife, $3,000 every 5 years is not something that would kind of turn me on a lot. You know what I'm saying? So, your thoughts?
Yes, thank you. I very much appreciate the question, and I certainly would like to see it be significantly higher in terms of the bonus structure. There are also some other there's other legislation that would make bonuses annual and would amount over that 5-year period to a larger amount. So I agree that there are this number could be higher, and there's a different way to structure it. The reason why I structured it, to try to answer your question, the reason why I structured it the way I did had to do largely with, again, thinking about personal experience. And if over that time, at 6 months and then 3 years and 5 years and every 5 years, if my wife had received $2,500 or $3,000, that's money that our family could have used for family vacation. It's money we could have used to pre-buy oil, for example, for the winter. So that was my thinking behind creating this particular structure. I think there are lots of ways to do it, but to answer your question, as I crafted this legislation, that was my thinking about spacing it out over 3 years to 5 years. As I said, there are other ways to do it, making it annually or quarterly, for example.
Thank you very much.
Thank you. Representative Merchant.
Thank you, Mr. Chairman, and also thank you for taking the question. I totally understand where you're coming from with workforce participation. It's critical, based upon what you just said here in your testimony, a 1.3% increase on the women part of the workforce would increase the GDP of the state by $1 billion per year. Why come to the state and ask for that assistance? Why would not the business community itself step to the plate? I mean, it's in their best interest to support this cause. Why not reach out to the business community and having them solve some of the problem versus coming to the state?
So I will, unfortunately, fortunately, my co-sponsor is somebody from the business community, Senator Fenton, and I think he would be someone who would be good to speak to that issue. My question, in response to your question, is by business community, do you mean the child care businesses themselves, or do you mean, what, could you clarify the question for me?
Yeah, go ahead.
It's not the child care industry itself, it's the ones that use the workforce that the child care industry would support. So if you're looking at greater participation from the workforce, I would assume, clarification here, that what you're asking for is to have more people in the workforce so that the economy can become more robust. Not so much specifically with child care, but the economy overall.
Thank you for the clarification. Well, I certainly think that businesses in our community should be willing to contribute more for exactly the reason you point out. I don't believe that provides any consistency over the middle or long term, right? There are businesses who may think we don't have that many people working for us, for example, who need child care, but also smaller businesses who may not have those needs, who may think it's a good idea, but may not feel financially incentivized to help out in a case like this. And then also, as I said, over time, if a business decides to contribute now or contribute 3 years from now, that doesn't mean that they're going to be willing to contribute 5 or 10 years from now. So having it structured this way provides a guarantee of consistency over time that the fund will exist. Whereas, as I said, I like your idea, but I don't believe that it provides that same stability.
Representative Weber, did you have your hand up earlier? Yeah.
I was wondering your thoughts on the trade-off of doing it this way versus perhaps something like restructuring our minimum wage here in New Hampshire, and did you give thought to that?
Thank you, Representative Weber. Thank you for the question. I think that both of those things can and should be done, right? As another representative pointed out, right, this is not a panacea. This is not a silver bullet. This is not going to raise wages to the levels that they need to be at in order to provide a long-term solution to this problem. So I think both of those things need to be done. I don't think they need to be done. They're not mutually exclusive. It's not that we do one or the other. I believe they both need to be done.
Thank you.
Representative Leon.
Thank you, Mr. Chairman, and thank you, Representative, for presenting this bill. Looking at your testimony, you spoke to how for state government jobs, we offer the recruitment and retention bonuses. And you were speaking about offering that same benefit here in private child care businesses. You've also spoken to increasing that amount, increasing the wages. I'm just curious if this is moving towards more of a public-private partnership of looking at basically extending the public schools down to early education, or looking at a fully public model. I'm just trying to understand where you're headed here. Thank you.
No, thank you very much. And where I'm headed is adequate compensation for the workers in this field, ultimately. And I do think that has to take the form of some kind of public-private partnership. In fact, when our committee, I'm on Environment and Agriculture, but when we had coffee with the governor a few weeks ago. I was talking to Governor Sununu, and that's exactly the phrasing that he used when he was talking about how he envisioned us going forward, being able to help build this workforce. Is we have to find a way to have a public-private partnership. The idea of, for example, having our public schools extend down, right? So if we had something like a universal preschool that got folded in at age 3 into our public school system, the problem with that, and I think our providers here could speak to it more eloquently than I can, is that's going to kill childcare for younger children. That's the most expensive childcare. And so if we were to fold 3 and up into our current system of public education, it would absolutely, my understanding, could perhaps speak to that more, it destroys the private business model of childcare for infant to age 2.
Okay. Thank you. Representative Shapiro.
Thank you, Mr. Chair, and thank you for taking the question. Are you aware that a single parent with 2 children who is starting off working in daycare and making, I think you said $28,000, would be eligible to receive Medicaid benefits for their children? And aren't we kind of passing on other costs to the state by paying our child care teachers so little?
I had not thought of that, but as you pointed out, yes, absolutely. And I think your point is very well taken, right? That there are added costs to this already for the state that I haven't addressed in the bill, but that you addressed very well there. Thank you.
Thank you. Other questions? Okay, I see none. Thank you very much.
Thank you all very much.
Also signed up to speak this morning is Senator Fenton.
Thank you, Mr. Chair, and ladies and gentlemen of the committee. For the record, I am Senator Donovan Fenton. I represent District 10, which is a lot of towns, so it's mostly Cheshire County and Peterborough. I have no formal written testimony. I'm actually going to hang up my hat as a legislator today and just talk about my experiences. I have a 4-year-old and a 2-year-old, and my 2-year-old was on a 16-month wait list for childcare. I'm also a business owner, and when I go out to hire prospective employees, I can't hire employees because they can't find childcare here in New Hampshire. And I'm in Keene, so I sit on that border right between Vermont and Massachusetts, and I try to attract them, and I just can't, you know. The barriers for childcare, for housing, whole different story, are real, and I'm dealing with that daily. And that's truly, really all I have to say. If you guys have any questions for me, Representative said I was a business leader, but I'm not sure about that. But I'm happy to take any questions about a public-private partnership.
Thank you, Senator. Any questions for the Senator?
Oh, I thought you were going to let me off easy. Go ahead.
Yes, go ahead.
Thank you, Chairman. I've seen articles and things in the past where, I don't know if it's necessarily New Hampshire specific, but let's say you want to have a little daycare in your home, that there are regulations that require you have like $10,000 stoves and you know, your air quality has to be specifically perfect, and there has to be, you know, rubber on everything to prevent somebody getting injured, and there's all these regulations and stuff. Can you address that? Is there a sort of cost that is burdening people from getting into childcare work? Because it seems to me like you want to get into childcare work and you're like, oh, sorry, I have to retrofit my house for $15,000 just before I'm allowed to even like do that. So that could be a serious barrier right there. You know, maybe we could move in that direction instead. What are your thoughts about that? Thank you.
Yeah, thank you, Representative, for the question. I think that's twofold. Now, I think what you're addressing is starting your own daycare business versus we're trying to attract educators to the field. Because there's no accessible and there's no affordable childcare. I think that is an option. I think another option would be loosening barriers to have daycare centers in businesses as well. The problem is we have to do something because it is a problem. And you know, a strong economy is based on a strong childcare workforce, and we do not have that. And it's really gonna hurt us in the future. But I do think that's a good point you brought up, Representative.
Representative Leon.
Thank you, Mr. Chairman, and thank you, Senator, for coming
to
over
see ya.
here. Congratulations. It was great to serve with you on those committees last
Absolutely.
year. My question is about how we're having this committee that's looking at childcare and looking at the overall question. And as a business owner, I just want to ask you how much these subsidies, where the fiscal note came in, I think it was $3 or $4 million a year, how these subsidies to just go a short distance to slightly alleviate the problem are going to make a meaningful impact, as opposed to looking at those larger structural issues about being able to bring in a child care center into your office. Maybe some of the downtime for your employees, providing some of that coverage for their coworkers' time. How much do we need to reimagine this, and is this subsidy just a Band-Aid?
Thank you for the question, Representative. I don't believe I've seen the fiscal note yet for this bill, so I'm not sure if that's what you're referring to. I'm not sure what it is. That being said, you know, a Band-Aid is better than a wound right now, in my opinion, because we have nothing. You know, like I said, my child was waiting for 11 months up to, and it's, you know, I'm not the only person feeling this. I'm sure you all have kids or grandkids that are in the same boat. I'm lucky I live near my mom, and we dump our kids on her all the time because we can't find a babysitter, and sometimes the child care center closes at 4, whereas I work till 5, or I'm here a little late, depending on how late committee goes. So I think any options right now are on the table.
Thank you.
Yeah.
Thank you. Other questions?
Thank you very much.
Okay, thank you. Okay, also signed up to testify is Donna Hajar from the Learning Path.
I'm new at this. My name is Donna Hajar. I own the Learning Path Child Care Center, and thank you for meeting with us today. The business of child care is an important one. I say it all the time, we are a legitimate business. Our monthly costs are over, you know, they're millions of dollars a year. Dollars spent at local businesses, we pay federal, state, and local taxes, and we employ thousands of local residents. We do not get refunds or discounts for any of these expenses, but our annual income compared to our annual expenses is skewed. I established the Learning Path in 1999. Up until recently, I owned 2 large centers employing 45 teachers. I sold my Derry Center in December, but I still own my Salem Center. I have 23 teachers employed. These 23 New Hampshire residents who I am responsible to keep employed, I need to offer benefits and increase salaries on a regular basis. For the Learning Path to run effectively and to reduce staff overtime and burnout, I've been advertising for 2 new teachers. Because we are not an industry that can function without a full staff on a daily basis. Centers are forced to close classrooms because of our low staff. And in turn, this leaves families without dependable childcare, like you just heard the gentleman here. Help is needed. Any help will do. A Band-Aid is better than a wound. And we need it soon. There is an unprecedented staffing crisis within the childcare industry, and I've never seen this before. Please, let's work together. We could use your support. We are the workforce behind the workforce. Thank you for your attention.
Thank you. Questions? See anything handed? Yeah, go ahead, Representative King.
Thank you, Chairman McDonald. Thank you for coming today. So you've got business acumen, it sounds like. You probably balance a budget and checkbook and these sorts of things.
Yes.
I don't know if you would be able to answer this or not, but let's say you did get like a $3,000 check from the state of New Hampshire. Do you think you would likely have to pay federal income taxes on that? Would you end up spending like 30% of that just to give to the IRS? And if so, do you think it might not be better for you to receive more of a like a tax rebate in the like, so for example, let's say you're paying, I'm just making up numbers here, $10,000 a year in property taxes. What if you had to pay $3,000 less in property taxes? That would be, right, that's still $3,000 more you have in your pocket, plus you're not having to give a a third of that to the federal government,
Mhm.
right? So maybe we could, how do you feel about, instead of the money going from taxpayers to the state of New Hampshire and then to your pocket and then to the IRS, what about just less money you have to pay to the state of New Hampshire? What do you think? Thank you.
Well, that's definitely another good option. The responsibility of the child care centers, once they get that tax credit, would it go to staff? They would have to be responsible owner to make sure that that credit goes directly to the staff and not to the business itself.
Okay, thank you. Other questions? Yeah, Representative McLean.
Thank you, Mr. Chair. So, of the 23 workers that you have in Salem, and you're right on the border with Massachusetts, what is your retention like? How long have you had these 23 people, and what would the impact of this bill have on the retention of those 23 folks?
I opened the Salem School in 2011. My director has been with me ever since. And then I have teachers that joined us right away and are still employed. And I have teachers who have left to go to different fields because of the expense, the low salary. So compensation is important to retain, but we can only do so much because what happens, it has to come out of the tuition rate. So tuition goes up, and it's the parents who are now struggling because now, again, it's already high enough tuition.
Representative Leon.
Thank you, Mr. Chairman. Thank you. I'm just looking at, sorry about that. The question is, we're looking at a huge lack of supply, and then we're also looking at the low rates. I'm trying to understand as a business owner how you're balancing increasing the rates so that you can provide that available coverage for people who need it, while being able to pay your employees more, but then also making sure that it's not pricing out other people in the market. I'm just trying to understand how you get to that because I'm an economist. I look at supply and demand. You balance the price with the need, and I'm just trying to make this compute.
Yes, and again, it's raising tuition every time, staff gets increases. So for September, rate increases are expected, and it's not a low percent. We give $1 an hour raise every year to my staff. So if my staff has been with me for a long time, they're making more than they are in other centers, but it's expensive to do that. We are cutting back. We're raising tuition and maybe cutting back on other things to accommodate that.
Thank you.
Other questions? Representative King.
Thank you for taking my question, and thank you, Mr. Chairman, for giving me the opportunity to ask. When I hear all the numbers and what keeps coming into my mind is, what in your mind is driving the salary rates up, and what's which then increases the amount that you have to charge parents. What factor do you attribute that to?
Well, we always look at, of course, the minimum wage. We are a Massachusetts border town. My staff could go over the border and make substantially more than that. So that's always a struggle. So, and raising tuition is our only solution to that problem.
Thank you.
Thank you.
Other questions? Yes.
Thank you again, Chairman McDonald. Again, I don't know if this is how it is in New Hampshire, but it's my understanding that in many states, in order to become any sort of child care provider or nanny or such, you have to get vaccinated with COVID-19. Do we have any requirement in New Hampshire to do that?
No, we don't.
Thank you.
Okay, other questions? I see none. Okay, thank you very much.
Thank you.
Also signed up to testify this morning is Elizabeth Brunette from the Applewood Learning Center. You have 3 minutes. just to remind people. I haven't said it for a while.
Thank you for having me. This is my first time testifying, so bear with me.
You're welcome. Welcome. Thank you for being here.
My name is Elizabeth, or Libby Brunette is how I go. I'm the director of the Applewood Learning Center in Londonderry, and I wanted to lend my support to this bill. As a veteran director in the field of early childhood education, I can tell you that hiring qualified teachers has always been a struggle, but since the pandemic, it's nearly impossible. I have had 2 open positions in full-time open positions with benefits for over 2 years now, and I cannot fill them, which results in me shutting down a classroom of infants and toddlers, which could accommodate 8 children. Now, 8 children doesn't seem like a lot, but when you have a waiting list of approximately 80 children, it's 10%. So we're talking about a significant number of families that are not being served because we cannot staff our programs. Most of the time when a family misses the opportunity to enroll when we have an infant opening, they're looking at a 2 to 3 year wait on our waiting list. It's only until their child is preschool age that they are then able to access high quality child care. This potentially results in a parent being out of work for about 3 years. Our staff are in desperate need of support. We have teachers in our program who are qualified to work in the public school, but because of their own dedication to the field, they have stayed. They're oftentimes only able to do this because they have a spouse who makes an adequate income, they're living at home with their parents as an adult, or they're taking on a second job, which oftentimes that second job, supplementing their meager income with us, is sometimes more than what their hourly wage is with us. These teachers are laying the foundation for children's lives. They're learning their way of being in the world. The groundwork we are developing is helping to set them up to be contributing members of society. The National Forum on Early Childhood Policy and Programs has found that high-quality childcare is a $4 to $9 return for every $1 invested. So money spent in childcare is just smart spending. Thank you.
Thank you. Are you taking questions?
I can, yes.
Any questions for this lady? Yes, Representative Polazov.
So, talking about business decisions, if you have 80 people pretending for 8 spots, what stops you from raising rates? Is there a concern that demand will drop significantly in coming years? Or why you're not just raising the rates to raise the salary? Thank you.
Why are we not raising the tuition rates? So our tuition rates are probably I would say the second highest in our town. For a full-time infant in our care, it's over $400 a week. So families can't afford that. They're paying more for childcare than they are for their mortgages. So we can't justify, we can justify it's the actual cost of quality, but we'll then end up with people going to lesser quality programs.
Okay. Other questions? Okay, I see none. Thank you very much.
Thank you.
Also signed up to testify this morning is Jackie Cowell from the Early Learning Center, Early Learning New Hampshire.
Good morning.
Morning.
Hi, I'm the executive director. I'm Jackie Cowell. I'm the executive director of Early Learning New Hampshire. We are a statewide nonprofit with membership services for childcare programs. We do cost buying and sharing and trying to help them put money back into their into their budgets. We also do some of this advocacy and on behalf of both the employers, the childcare programs, the teachers, and the families they serve. So our mission, if I didn't say it, is that we are committed to ensuring that every New Hampshire child has the opportunity to reach their full potential. So I'll be really brief because these are the people you really need to hear from most. But I used to run for about 13 years of childcare in New Hampshire. So and so what I'd like to say first, in addition, You heard well about childcare, both supports the workforce of today, but it really, in partnership with parents, it helps prepare the workforce of tomorrow, too. Something you may not realize, the math works on this, is that a child whose mom or dad or both work 9 to 5, Monday through Friday, can spend more hours in childcare than they will in their public school career all the way through grade 12. The math works on that. And of course, you probably all know about the development of the young child and now the brain neural connections that are being made. This time of their life is so important to have great experiences. So that's another thing that childcare does, in addition to supporting the workforce that people have mentioned very well. Representative Nagel, you had a question about turnover, and what I can tell you is not many surveys have been done during the pandemic. It's all over the map, and people say it's not indicative, but before the pandemic, and we know it's worse now. You've heard that. It really is worse now. About 30% of the workforce turned over every year. So by 3 years, you almost have a whole new workforce there. Yes, there are people who stay, and it's wonderful. That's what we're trying to do a little bit with this bill. From my work working with young children in a childcare program, I can tell you we use the word turnover, but you ever go into one of those classrooms and you hear the teacher, their 3-year-old, in front of the 3-year-olds telling them she's leaving, you don't call it turnover. Pardon me, you call it loss. And we really don't want this to keep happening in the lives of young children. And so what we're really trying to do with this bill is whatever we can do. In addition to Band-Aid that's been talked about, I would call it a bridge. As the Health and Human Services and Elderly Affairs Committee, I would love for you to, on a policy level, say we support the idea of supporting the workforce. I tell you it's going to go a long way to the field to hear that you've done that. Let finance figure out the financing, figuring out, where it's coming from, whether it's here or from there. But I would love it if the Health and Human Services and Elderly Affairs Committee would pass it along to finance. Say why it's so important. It will honestly go a long way to the field, knowing you understand the work they're doing and the teachers. And that's all I have to say.
Great. Thank you very much. Questions for this witness? I see. Yes, Representative Polazov.
Do you know what portion of tuition generally goes towards staff salaries as opposed to other business expenses?
Oh, thank you. I like that question. In fact, about 80%, 80 to 95% of the tuition that comes in, whether it's, sometimes the state pays a portion for families whose incomes, but it's no more money. It's still let's say it's $400 a week. State might pay this much, the parent pays this much if they qualify for the state subsidy. But the point, that's that tuition. Whether nonprofits and privately owned, almost all the money goes towards personnel. It's a personnel heavy if you're doing it right? So 80 to 90% of your expenses are the people doing the work, and 80 to 90% of your income is the tuition. That's where people have talked about why it's so hard. The parents don't have it. You can charge it, but you'll end up with balanced dues, and it doesn't help the child, and it doesn't help the family, and it doesn't help the program. So we're looking to see if there's any other places besides the parents to try to do something for the workforces.
Other questions? Representative Nagel.
Thank you, Mr. Chairman. Thank you for taking my question. I'm really struggling with this bill for a lot of reasons. When I did the math, it's about $8 million. Am I correct? Over 3 years? On the last page?
It's over the 3 years. It looks like the fiscal note that came out yesterday was $3 million in the first
Oh, I
biennium,
see. I
$4
didn't
million
see.
in the next, and recurring.
I see.
And the reason why I bring that up is what you do is really important, and I really appreciate everything we're trying to do, but I want to make sure that this is an effective Band-Aid.
Got it.
You're competing with virtually every industry in the labor market, and virtually everybody's doing this, and everybody's ending up in pretty much the same place they started with. So
Right.
why would this be different
Got
to
it.
improve your your employability versus others that you're competing against?
And again, the field, obviously more would likely help more. But, and there are some bills, you'll be seeing them hopefully from the Senate, that actually do invest a little bit more and annually. However, if there's honestly, something really needs to be said, and I do think it will have an effect. Would more money have more effect? Yes. But that's where I think finance can get into the details of it. And you know, I really thank Representative Germana and Senator Donovan for doing this effort to try to start and do some help. I really want to say, you know, it's going to go a long way. The messaging, the saying it's important that we're going to invest will make a difference. Well, I think it's a bridge. It's a bridge to other solutions. You know, there's the Select Committee on Childcare, but they may not have some, you know, solution-based legislation perhaps till next year, or who knows. We need to do something now to tell the field. And I do think it'll keep some of the talent there. I really do. And we really want to keep the talent as much as we can. And the other thing with the empty classrooms, Representative King, you mentioned about the home child care programs and how difficult it is. Right now, and I don't have the number, there's been no formal survey of how many child care classrooms are just empty right now. They have the electricity, the heat, the toys, the classroom, they've got everything except the staff. If we could do something, there's incentives here for new staff, et cetera, we might be able to start filling those back up, and that will have an effect too.
Okay, thank you. Other questions? Yes, Representative.
Thank you, Mr. Chair. Thanks for taking my question. Kind of following up on what Representative King asked. I know he asked about the overall COVID-19 vaccine mandate not being a thing, but is it a thing for individual childcare learning?
Yeah.
So have a lot of them made that decision?
To leave the field, you mean? As
No,
oh.
yes, exactly. Yeah.
That's a good question. Let me just,
Okay.
they're better at this. I haven't heard it, put it that way, that it's made a big difference in time. The difficulty of COVID, of closing classrooms and not being able to get paid and all the sorts of things, that's been tough, but I don't think it's about a masking. So or vaccination. Let me just ask.
Yeah.
Has the masking or vaccination been an issue in losing staff? I think at the beginning, maybe a little? Okay. Right. Okay, sorry. Yeah. Okay.
Okay.
But I think there have been quite a bit of returns. You know, there was sort of a panic and a misunderstanding in the beginning of the March, April, May. There have been some returns, but I don't have that stats. But right now, the difficulty is simply if, you know, and the state is trying to help with this, that parents, if the classroom has to close, but that's a whole separate,
Follow up.
Follow up.
Thank you. So are there still centers implementing those mandates?
There may be, Representative, I don't know. It's
Okay.
not often talked about, or what's talked about is the difficulty of having to close a classroom down and parents not being able to have childcare and staff not being able to get paid if they've got it, but not about vaccinations or masking, yeah.
Do you have
Yeah.
a follow-up, another one?
I do.
Yeah, sure.
Yeah, so with that said,
Yeah.
that could be a real issue for staffing. So has there been conversations around
Not closing down, maybe you're saying?
not dropping those to encourage people that may have left
Yeah.
and what to come back and solve
Right.
some of these staffing solutions? Because yours isn't the only field we've heard this in.
Of course, yeah.
So, and we're trying to get to the root of a lot
Yeah,
of these
yeah.
issues.
And I'll be honest, it's not a big talked about thing for a reason to leave the field. It's not a big reason that people are talking about to not come in, honestly. However, they are following the CDC guidelines as they are right now, so, yeah. It hasn't really been a big discussion. The inability to cover their costs, you know, anything that can help them meet their rent, any help is really what they're talking about, the field, yeah.
Okay, thank you. Any other questions? Representative Shapiro, did you have a question, or? Oh, okay. I see no other hands, so thank you.
Thank you.
Also signed up to testify this morning is Will Stewart. You have 3 minutes, sir.
Thank you, Mr. Chairman, members of the committee. My name is Will Stewart, and I am the Executive Director of Stay, Work, Play New Hampshire, and we're a statewide nonprofit whose mission is to attract and retain more young people here in the Granite State. And that's important, just to lay the groundwork for a few reasons, one of which we're the second oldest average age in the country. Here in New Hampshire, have one of the lowest unemployment rates and one of the highest out-migration rates of high school seniors. We need more people in general. Here in New Hampshire, we need more young people in particular. And these are just some of the reasons that Stay Work Play is in support of this bill and others this session that look to support childcare and the childcare workforce in particular. Young people, here in New Hampshire, are needed not just, as we've heard, as employees for our state's employers, but to serve an elected office at the state and local level, to serve local nonprofits, to pass the plate at church or synagogue. We need more people. And for young people here in New Hampshire, childcare, as we've heard, is a major issue, and one of the reasons that we don't maybe have as many kids, and one that will encourage others to leave the state, among others. Young people in New Hampshire face a number of challenges, some of which we all face, some of which are unique to young people. Certainly, we've all seen housing costs, skyrocket on the rental market in particular, which are disproportionately occupied by young people. We've seen utility costs, increasing, which affect us all. Young people in particular are more burdened with student debt, having those payments, and of course with childcare, being young people of childbearing age. These all kind of come together to create really a perfect storm of challenges for living in New Hampshire and being young. And I'll leave you with this one anecdote that you heard from a young woman in the Upper Valley a few years ago when we were out kind of making the rounds, talking to young people in each region of the state about, what makes it a challenge, to live in their regions of the state and what they like about it too. And as I mentioned, this one young woman was in the Upper Valley, but I think the comment applies to New Hampshire as a whole. She said, the Upper Valley is a wonderful place to raise a family, but it's a really terrible place to try and start one. And that comment is one that's kind of stuck with me, these past 2 or 3 years, and really helps fuel me and our organization to do everything we can to make New Hampshire, more amenable for young people and easier to live here. And of course, that includes everything that we can do, to lower the cost of childcare, for parents who don't, are a little bit more challenged in being able to address those price increases. So thank you for listening to me today, and happy to answer any questions anyone might have.
Okay, questions? Yes, go ahead.
Thank you, Mr. Chair. Just quickly, in your capacity as Executive Director of Stay Work Play, have you ever looked at the retention rate on child care workers in Massachusetts versus New Hampshire and compensation in Massachusetts versus New Hampshire? Have you looked at those figures, or do you have access to them?
That's not a level that we get into. I would defer to my colleagues who are more literally and figuratively invested in the child care industry.
Mr. Chair, would
follow up?
Would it be possible? Ms. Cowell raised her finger up, so she might have that answer. Would it be okay if she answered that question?
Sure, go ahead.
Thank you, Representative McLean. The New Hampshire Bulletin recently had an article.
If you could come up to the microphone so we can hear better.
Sure. Hi, again, Jackie Cowell from Early Learning New Hampshire. The New Hampshire Bulletin recently had an article by Anne Marie Timmons, which mentioned that in Massachusetts, the average salary or wage is about $10,000 more than those in New Hampshire childcare folks were earning. In Maine, I might be mixing this up, but I think in Maine it's about 8,000 more, 8,400 more, and in Vermont it was about 6,300 more. I may be not exactly right, but $6,000, $8,000, $10,000 difference per year, and I don't know the turnover. Sorry.
Okay, thank you. Other questions? Yes, Representative Merchant.
Thank you, Mr. Chair. And also, could you follow up on, they're paying the workers more. Where's the additional money coming from?
I'm sorry, I didn't realize. Yes, go ahead. Sorry.
You, you mentioned in other states, Mass, Maine, and Vermont, the healthcare workers making more in those states than here in New Hampshire.
Yeah.
So in order to compensate them for the additional wages, where's the additional money coming into the business to support? Is it coming from the private market, from the public market? How is that being sustained and maintained?
The bulk of the money that goes into a childcare business to pay their staff is from parent tuition. Yeah, thank you.
Other questions? I'm seeing no other questions, so, oh, I'm sorry. Go ahead, Representative.
Thank you, Chairman. Mr. Stewart, thank you. You presented a lot of facts that I thought sounded great, but I'm wondering if you could send the main bullets of your oral testimony in writing somehow.
I would be happy to do that.
Thank you.
Yes.
Okay, thank you. Other questions? I'm seeing none. Thank you very much. Also signed up to testify this morning is Lynn Willett.
Good morning, and thank you for having us.
Good morning.
So my name is Lynn Willett. I have been in the field of early childhood for 41 years now. I am a director at a school in Amherst, New Hampshire called Nellie's Treehouse. I currently employ 15 employees. I need 19 employees. I have had ads out for months and months and months. Sometimes we hire someone, they accept a position, and they don't show up. In doing this for 41 years, our primary goal is to make sure that the children in our care are loved and have consistency so that they can learn appropriately. That is not happening now. It isn't COVID that caused, COVID started the problem, but it's always been a problem. But right now, when I have an employee who comes in and I say, I can offer you $15 an hour, Target down the street is offering them $20. I can't raise my parents' costs anymore. And when I do raise their costs, they have to consider their housing, their electricity, their food, everything rising for them. My staff deserve to make a living wage. I work in the classroom because we don't have staff. I have a wait list of 87 children. And on Monday, because of my lack of staffing, I had to call 2 parents and say, I am really sorry, but your children can't start next Monday, and I'm not sure when they can start because I had a staff member who left to go work at Target, and I had a staff member who took a job in a dental office for far more than I could pay them. We need to help our families. New Hampshire is a family-oriented state, and our children deserve the best. And if we want a workforce, we need to support childcare because we are that workforce behind that workforce. The parent I called on Monday cried because she needs to go back to work. And I can't help her because I don't have the staffing to take her children. I know that there were a lot of questions about masking and COVID, and we just stopped masking in September for our staff. A lot of our staff have voluntarily gotten all of their shots, and we offered a stipend for them to do that if they did it. But it's not the end-all, be-all. A lot of our staff are very dedicated to what they do. And if we don't stop and find a way to get people into this field, we won't have a child care field in a few years. So we appreciate you taking the time to listen to us. We appreciate anything you can do for our field. I know $3,000 seems small, but to some of my staff, that's a huge, huge benefit, even if it's every 5 years. So we want to provide the students of the children of New Hampshire with quality, consistent care so that they can learn and grow. We want to provide New Hampshire with a consistent quality workforce. And we want to make sure that we're doing everything that we can to support our families here without having to tell someone on the phone, hey, I'm sorry. I know you would do it to start Monday, but I can't take your child.
Okay. Thank you.
And she has nowhere to go.
Thank you very much.
You're welcome.
And any questions? I'm seeing no questions. Okay. Thank you very much. Also signed up to testify is Mary Ann Barker. have 3 minutes, ma'am.
Thank you. Hi, I'm Marianne Barter. I'm the Executive Director at Merrimack Valley Daycare Service in Concord, and I'm the Chair of the New Hampshire Child Care Advisory Council. I just wanted to testify because I felt like I could explain a couple of the questions that have come up. The first is that when I started in childcare 21 years ago, I was offered $11 an hour. There are still childcare workers who are making $11 an hour, and that's because the economics of childcare does not allow salaries to match the rising costs in New Hampshire. It is expensive to live here. Our agency primarily works with low-income families, children at risk of abuse and neglect, and children with special needs. And I have never had a person come to my office and say they are leaving our center because they don't believe in our mission, but I've had plenty come and say they're leaving our center to work at Target. And I find the idea that people who are passionate about this field and passionate for this work having to leave to work at Target incredibly depressing, and it impacts all of us. I am a nonprofit agency, so unfortunately the tax rebate wouldn't work for me, but I think that that's something that's absolutely worth looking at to increase for-profit and proprietary centers as a way to increase their financial resources. I think that's a great idea. I did want to say that I can't raise I can't raise salaries larger than they are. I can't raise tuition larger than it is because the bulk of my families fall within that range of making too much money to get state assistance, but too little money to really survive and thrive in New Hampshire. And I already give them a sliding fee scale, and I know for a lot of those people, that maxes them out. We also have a food pantry on site, and there's many a time that I see the families come and pay me their tuition, and then they visit our food pantry. And that is disgraceful in the 8th richest state in New Hampshire. I'm sorry, in the United States. That is just unbelievable to me. I also wanted to mention that we remained open during COVID because so many of our families are low income, and frankly, they didn't have another option, and because so many of my colleagues had to close, that we really wanted a safe place for children to come in the Concord area while the parents worked. We also have a lot of protective children, so we felt like that they needed a safe place to be while their parents worked on their issues. During that time, I never lost an employee due to any COVID-related issues. During that time, afterwards, I never gained an employee because of COVID-related issues. We masked sometimes, we didn't mask other times. Most people are probably vaccinated, but I don't ask. We're doing the best we can to serve our families. I will say that in childcare conversations, I do not hear COVID restrictions coming up very often. So that's my testimony. I hope that you folks see this bill the same way we see it, which is a bridge to get us to the next step. I think in 4 or 5 years, childcare in New Hampshire is going to look extraordinarily different. There's things in place and things that people are starting to talk about at the highest levels that will change the way New Hampshire handles childcare, and I think that's amazing. But we need to get there with an experienced workforce in order to take advantage of these changes. We're going to have an entire generation of children that do not have appropriate safe care during the day.
Okay.
So that's my
Thank
testimony.
you. Questions? Yes, Representative.
Thank you, Mr. Chair, and thank you for taking my question. So there are educational freedom accounts available in New Hampshire right now. Would any of the parents who utilize your Learning Center services, have you directed them to the use of those accounts?
Are they available for preschool-age children?
I mean, they're learning centers, you said, so I guess.
I thought they were in lieu of education, a regular school. That's
Yeah,
what
so I
thought.
wonder how that, like, as a learning, if you're in a teaching environment versus child care.
Yeah, I mean,
is-
I think the distinction between childcare and
Right.
public education, that's always been sort of a funny relationship. We would have to investigate that further. I've certainly never heard of anyone successfully using the Freedom Care accounts
Yeah,
to pay for their
I don't believe
tuition.
that's how they're set up, but.
Okay, thank you.
Other questions?
Oh, I'm sorry,
Go ahead.
Representative McLean, I did just want to say one thing. In Maine, they put $12 million into their general budget for supporting the child care workforce, and the way they do that is that every month a child care provider, every individual teacher and provider receives a $200 stipend. So, and that has increased retention exponentially.
Okay. Other questions? Seeing none? Oh, I'm sorry, Representative Weber.
And would you be surprised to know that for that extra $200 that the Maine teachers are getting, for 30% of that to go to the federal government, the teacher would have to be making more than $170,000 a year?
Oh, that's interesting. Thank you for letting me know that.
Yes, Representative.
Thank you. Just a quick question. Can you please repeat your name and your organization?
Yes, I'm Miriam Barter. I'm the Executive Director at Merrimack Valley Daycare Service, and I'm the Chair of the New Hampshire Child Care Advisory Council.
Thank you.
Okay, other questions? Okay, I don't see any, so
Thank you
thank you
so
very
much.
much. And the last person signed up to testify on this bill this morning is Sebastian, and I apologize if I mispronounced the last name, Fuentes?
You got it right.
Oh, excellent, okay, I'm doing well.
Thank you, Mr. Chairman, and thank you, members of the committee. Once again, my name is Sebastian Fuentes. I'm the Movement Politics Director for Rights and Democracy of New Hampshire. But I'm here, most importantly, kind of representing myself. I have 4 kids myself. 2 of them are 3 and 2 years old. The only reason why I have this job and I'm able to do this job is because my wife has to work 3 shifts, 12-hour shifts overnight, so somebody can take care of our children. And why is that? It's because we cannot afford the $640 a week to take care of for two kids on the daycare system. So I'm here to in support of this bill to see if you guys can provide the right amount of support to the childcare workers that need it so much. Another thing, for 20 years of my life, I work in the hospitality industry up in the North Country. Representative Keene might be aware, my Washington Hotel is one of the largest employers up there. Many times, and I can count about maybe 50 to 60 people that we interviewed throughout 10 years that have to leave the area or cannot take a job because they cannot find childcare available in the area, and whatever is available is not affordable. So whatever you guys, this committee can do to help the childcare workers in New Hampshire, that'll be greatly appreciated. So that's all my testimony. I think many of them give their good perspectives, but I wanted to give another one as a parent of somebody that has to struggle with this every single week. Thank you so much.
Thank you. Are you taking questions, sir?
Absolutely, yes.
Are there any questions for this gentleman? I guess not. Thank you very much.
Thank you so much.
Okay, I have no one else signed up to testify. Is there anyone present who does want to testify on House Bill 566? Okay, seeing no one, I am going to close the public hearing on House Bill 566. At this time, it's just it's approaching the lunch hour. I know last week we skipped lunch, but we're doing much better today. So would anyone object if we recess until 1 o'clock? Okay, yes, Representative Weber.
Could I just ask what's happening with 574A? Are we going to hear that first thing after the lunch hour?
We will, yes, Representative.
Okay, thank you.
Any other questions? Any other comments? Okay, we stand adjourned, recessed until 1 p.m. Hello, everyone. We want to reconvene at this point. I am opening the public hearing on House Bill 574 and welcome you all back. First person I want to recognize in terms of testifying is the prime sponsor, Representative Dan Wolf.
Thank you, Mr. Chairman, and thank you, members of the committee, for hearing this bill. I'm in strong support of this bill, and I'll give you a little bit of background, but I really have some experts here from New Hampshire Hunger Solutions in the Department of Health and Human Services that can get into the nitty-gritty. But what this bill does is provides an opportunity for people, women, infants, and children to get fresh produce at their local farmers markets. The coupons will be used that they now use in existing grocery stores. Federal funds will support 100% of the food cost, 70% of the administrative cost. Bill appropriates $300,000 for administration and enhancement of the WIC Foundation, providing an additional $30 in benefits to be used at farmers markets. The state match will draw down federal funds determined annually from the federal budget appropriations, and it will improve the awareness, use of, and sales of farmers markets. So not only will it help those people that have an economic need, it will help our farmers have another outlet for product. Why do we do this now? Farmers markets infrastructure exists in the state to support the program. There is an increased interest among farmers and recipients in this program. The Department of Labor has just reported that over 6% in food costs have increased in the last 12 months. And allowing the Federal Nutrition Program participants to spend dollars at farmers markets may be the only way to increase market share for farmers by connecting them to new customers. I'd be happy to answer any questions, but I'm probably going to duck out and refer to the experts behind you. But if you do have questions, I'll be happy to take them.
Representative Leon.
Thank you, Mr. Chairman, and thank you, Representative, for being here and holding over through lunch. My question is regarding the federal funds, and if you would be willing to have a sunset provision that should the federal funding go away, this program also leaves our statutes.
I think I'm in favor of most legislation having a sunset thing. So yes, I think we would. And just in speaking with the people from the department, if there is no demand for this program, they would be willing to not apply for the federal funds and have it lapse too. So it's a two-way street.
Thank you.
Other questions? Representative Merchant.
Thank you, Mr. Chairman. Also, thank you, Representative Wolf, for taking the question. So basically, this is going to support our local farmers more than we have today. Is that kind of the intent of it, to not only help recipients of WIC, if you will, to obtain fresh vegetables and fruits and so forth, but also to help support our farming community, particularly them. Many of them are small farmers that could use the assistance.
Thank you, Representative. Yes, to me, it's a win-win situation. People that are on the low-income spectrum can get fresh produce locally, and our farmers can now provide for them. So I don't know why this shouldn't go to executing right now.
Other questions? Seeing no other questions? Yes, Representative.
Thank you. So is my understanding, it says it's reestablishing, so this is restarting something that existed previously?
That's my understanding. It was I believe it was a 2-year program, and it did expire, and now it's reestablishing the program.
Other questions? Yes, go ahead.
Thank you, Mr. Chair. Thank you for taking my question. Just real quick, line 6 on the second page, it says, "The program shall distribute food instruments." Is that just food, or what does that word instruments imply?
I'd have to ask the people that helped put this
Okay.
together.
Okay.
Okay.
Well, yes, Representative Weber.
Could I ask that we finish with one person's testimony
Sure.
before, and if somebody has a question that needs to go to somebody else, that they be asked to hold it, because otherwise we have people popping up and then popping
Sure,
down, and we get
exactly.
into
It's a lot smoother
conversations
that
that are
way, so-
confusing.
Yeah,
I
so
ap-
Representative Wolf, are you
I
all-
apologize
Any
for
other
that.
questions for Representative Wolf? Representative Merchant?
Thank you, Mr. Chair, and also Representative Wolf. I see this as a non-lapsing account, and it goes until the end of fiscal year 2024. Would it be opposed to making a lapsing account versus a non-lapsing account? So, and give it a time of 2025, so that the funds have to be expended by that period of time. Would you be opposed to that versus it being a non-lapsing account, which kind of goes on forever?
I wouldn't be opposed to that. I think that's some of the things that the department's going to speak to.
Other questions? I see no other questions. Okay, thank you.
Thank you very
Thank you,
much.
Representative Wolf. And since she had already tried to come up here once, I'd like to recognize Lisa Surroyce from the New Hampshire Department of Health and Human Services, Department of Public Health, to continue, and if you could keep your testimony to 3 minutes, that'd be great.
Thank you, Mr. Chairman and committee members. My name is Lisa Royce, Bureau Chief for Population Health. Prior to this position, I have been the WIC Director at the Division of Public Health for the last 6 years. So even in my new position, I still oversee this program. So just really quickly to lay the foundation. So the WIC Nutrition Program is a 100% federally funded public health nutrition program for low-income infants, children, pregnant, and breastfeeding women. Our program is different than other food access programs because we provide very prescriptive foods, whole wheat bread, low-fat milk, beans, peanut butter, infant formula, focused very much on the period of pregnancy, breastfeeding, and child development to get to healthy outcomes. So the WIC Farmers Market program is an add-on that is available for states that participate in the WIC program. All 50 states participate. There's actually 89 programs across the country because it's available for Indian tribal councils and territories. The program in New Hampshire last existed in 2011. It is a non-competitive program that's available for states. Back in 2011, the decision was made to close the program because the redemption levels were low and because of the state match requirement was no longer available to the program. So under this bill, it would reestablish the program, although it still requires permission from the United States Department of Agriculture, which we submit a state plan to each year, what gives us permission and then gives us some federal funding. However, we can't draw down that federal funds unless we can show that we have a match piece. The match piece is about 30% of the administrative grant that we receive. And just to put it in perspective, in Federal 22, while we didn't operate the program, we sent in a proposal to get permission to bring it back to New Hampshire. We received $110,000 for food and about $23,000 for administrative costs, which would then require about a $10,000 state match in order to operate. The federal money that is given to us would only allow a $10 benefit to be given to each child on the WIC program, which is about 10,000 kids. So you can see that going to a farmer's market with only $10 for your one child, you maybe are going to get a pint of blueberries or 2 pints of strawberries. So it's not much of a draw for families to travel to a farmer's market and use the benefit. So under this bill, this additional funding, the $300,000 per year, would give an additional $270,000 just to the food benefit, which would go directly to our New Hampshire farmers, and then $30,000 to help with the administrative costs. Now, within the last couple of weeks, the United States Department of Agriculture has shared that there are modernization grants available for states to try to move the WIC Farmers Market program away from this paper coupon system to an electronic benefit system, which could be a QR code on your phone or a plastic card, which would help with redemptions and allow farmers to get paid a lot faster. So the term food instrument is very old-fashioned, but it still exists in our federal regulations. It is generic enough that it allows states to have paper coupons, checks through banking systems, or electronic benefits, which could be a plastic card or a QR code.
If you could start wrapping up, please.
Sure. So under this bill, this funding would allow participants, pregnant, breastfeeding, low-income children up to age 5, to visit a farmer's market for a one-time benefit of $30. So the $10 from the federal money and then the additional $20 from the state appropriation to be redeemed for fresh fruits and vegetables at farmer's market. And the intent of the WIC Farmers Market program is exactly what was stated. It is to help low-income families access fresh fruits and vegetables at farmers market, and equally to support our farming industry in this country, specifically for us here in New Hampshire. And I'm available for any questions. Thank you.
Thank you. Representative Leon.
Thank you, Mr. Chairman, and thank you for being here. My question is if it's possible to make any requests to the federal government to allow this to be in a more direct person-to-farmer relationship, because I know that at least some farmers markets have price fixing, and it's probably the most expensive way to deliver fresh produce to people. And if there's some exemption to allow a process other than a farmer's market to get food from the farmers directly to the families.
Yeah, thank you for your question. I'm not sure I exactly understand what you're asking. Are you asking as opposed to at the markets at like grocery stores?
No, I'm asking, I'm sorry if I can answer
Sure,
that.
go ahead.
If they have a farm stand at the farm or some other way that the farmers market their food to the public, if there's some other way to do it without the added cost of picking up the produce, going to the farmer's market, that then requires people to get to that same place at the same time. And there's a lot of food waste that's involved. Is there any way to get a waiver to allow that to go to farm stands or other ways where it can be better integrated into the community to lower costs and increase access?
Yes. So under the federal WIC Farmers Market program, there are state options that allow you to choose just markets, farm stands, standalone farmer locations. So it would give the department some authority to make a decision what is the best fit for our state in order to get these benefits to our families.
That's incredibly helpful. Thank you.
You're welcome.
Thank you. Other questions? Representative Nagel.
Thank you, Mr. Chairman. Thank you. You said the program died in 2011, because of low redemption. What was the reason for that, and what's changed, do you think?
Sure, yeah, good question. Thank you. So I wasn't in this position in 2011. However, I was still at the department working under the program. It is my understanding that getting those match dollars became more difficult for the department, and the redemption rates were around under 50%. And so at that time, they were paper coupons that required families to go to the markets and redeem them. We have seen over the past 5 years more programs across the state move to an e-solution, more a modernized version of farmers market, which has allowed the redemption rates to increase significantly. So we feel pretty confident that moving to a modern version would really help those redemption rates.
Okay. Representative Merchant.
Thank you, Mr. Chair, and also thank you for taking the question. The one time, is it like one time per month, one time per year? Can you help clarify the one time, what that means?
Sure, thank you for that question. I should have explained that better. So it is a one-time benefit for the participant to be able to be used over the lifetime of the market season. So ideally, participants would be issued the benefit in June, and they'd have until October to redeem the benefit. At the end of October, the benefit then, however, expires. It's no longer available, which is very much the way the WIC program works. You get food for 1 month, it expires. There is no carry forward.
Representative Polazov, and I'll come back over here.
Thank you, Mr. Chair, and thank you for taking my question. My concern is if there will be limits for healthy food versus unhealthy food, and specifically my concern is you mentioned low-fat milk as a specifically healthy choice. So do you envision putting some limitations on participating farmers if they provide whole milk or if they provide butter or eggs?
Thank you for your question. So my reference to the healthy foods is specific to the WIC nutrition program, which is a separate benefit that families receive participating in that program. WIC Farmers Market is solely for fresh local produce, fruits, vegetables, some fresh cut herbs. There is no authorization for honey or baked goods or milk or any other foods maybe that you'd find at a farmer's market.
Yes, Representative.
Thank you, Mr. Chair. Thank you for taking my question. So just another quick one. So would every farmer be required to participate, or is it opt-in?
It's an opt-in program.
Okay.
Thank you.
Other questions? Representative Weber.
Thank you, and I have a question for clarification because you said in answer to a question about is this just farmers markets, that it could be individual farm stands and it can also be used under the federal program guidelines. It could be used at I believe grocery stores as well. I mean, we've had an iteration of this that included both local produce at grocery stores and local produce other places. But would we not have to amend this bill because the bill speaks only to distributes food instruments to redeem for locally grown fruits, vegetables, and herbs at authorized New Hampshire's farmers markets. So it wouldn't be left to the department to decide in that case, would it? Unless we revised the language here.
Thank you for your question and asking for that clarification. Maybe I misspoke, or when I was asking Representative Leon for clarification, it became confusing. This program does not allow the food instrument to be redeemed at a grocery store.
Okay.
It is only markets, farm stands, farmers, solely to support the farming industry.
And may I have a follow-up?
Follow-up.
But I'm still left with the confusion. Representative Leon's point, if I understood it, was it might be more effective to go directly to a farm stand, and although that would be acceptable under the federal program, would we not have to add farm stands into the language here for it to be authorized for farm stand use in New Hampshire?
I could look at that more closely with the bill's sponsor.
Okay.
There is availability under our regulations that allow some of those other opportunities.
And I don't want to beat a dead horse, but we're executing this bill tomorrow, and if there is need of an amendment, we need to get an amendment. So my concern is if what we're trying to do is include farm stands, this doesn't allow farm stand use.
Thank you.
Thank you.
Representative Kofalt.
Can you speak a little bit to the vendor authorization requirements and process? So my understanding is that in order to accept this as a form of payment, that a farm stand, if that is added to the bill, or an individual vendor at a farmer's market would be required to go through an application process, potentially even have electronic equipment for accepting electronic payment. I'm not sure if that would be required or not. Can you speak to that process, please?
Sure, thank you for your question. Yes, it is true. Farmers that would want to participate in the WIC Farmers Market program would have to be authorized, and there is a little bit of a process, a paper process, and typically an on-site visit, including civil rights training, for example, requirements by USDA. As far as, I'm sorry, I forget what the second part of your question was.
It pertained to any specialized equipment that might be required for accepting payment.
Yes, thank you for that. So we have heard from other states that have already moved along in the modernization process that farmers aren't necessarily interested in having little electronic devices at their stands because most of them don't have access to Wi-Fi. So there is more innovative technology available, such as using smartphones for farmers to be able to move to an electronic version. And so that, I guess that would be one of the decisions that the farmer would have to make for participation.
Other questions? Representative Merchant.
Following up, thank you, Mr. Chairman. Also following up on Representative Cofalt's question, to minimize the process to the farmer being so onerous potentially, when I shop at the local supermarket, there's times in which they actually have produce out there that says sourced from a local farmer. Would it be possible that within the grocery store itself, if they're obtaining the produce through the grocery store from a local farmer to minimize the farmer's requirement to apply for an application in the electronic, is that feasible under the federal law to say that if the grocery store can identify produce that's actually raised locally and sold through the store?
Thank you for your question. Under the federal regulations, no, that would not be an allowable activity.
Other questions? I see none. Okay, thank you very much.
Thank you.
Okay, also signed up to testify today is Tiffany Dodier from New Hampshire Hunger Solutions. You have 3 minutes, ma'am.
Thank you. Good afternoon, Chairman and members of the committee. Thank you so much for allowing me to speak to you today in our support of HB 574. My name is Tiffany Dodier, and I come to you in multiple capacities today. Professionally, as the Community Engagement Director for New Hampshire Hunger Solutions, I represent more than 300 of our partners statewide that are concerned and seek to improve access to nutritious local food for all people in New Hampshire. I also come to you as a dietitian to provide you with evidence-based information about this program and its effectiveness in improving health as well as improving consumption and purchase of fruits and vegetables. I also come to you personally as a woman pregnant with her first child to talk to you about my own feelings about how important farmers markets will be in raising my own child. So first I want to talk to you about the evidence for the program. And so it is shown that anybody attending a farmer's market, of course, has greater purchases of fresh fruits and vegetables. Specifically in the populations of those that have low income, it actually is shown to increase by their fruit and vegetable intake, and that's actual consumption, by as many as 8 servings of vegetables per week and 2.5 servings of fruits per week. So really effective in that sense, and that's been shown in studies across the United States. It increases specifically consumption of produce for young children as well. That increased consumption as well continues 2 to 6 months after the participation ends in that particular program. So that suggests that this is a long-standing change in behaviors that can actually take place and change their actual desire for these foods as well. As a dietitian, I know that it's really important to expose our young children to fresh fruits and vegetables at a young age to ensure that we establish good relationships with fresh produce and develop that desire and that taste for fresh fruits and vegetables. Good habits over a lifetime will reduce healthcare costs, and as well as build good purchasing habits and building community as well and being in community. As an expectant mother myself, I look forward to attending farmers markets. If anybody's ever been, they're really lively, they're really fun. A lot of times they have live music and other things to look at, people to speak to, and it really brings you into communities. So this is an opportunity for our children to watch us in our communities having these conversations with farmers, as well as programs like these, I believe, will also help people that believe that they can't afford or aren't welcome in these communities to be able to come to these communities. And so there's lots of opportunities for learning for young children to be able to both consume fresh fruits and vegetables, see where they're grown, see where they're produced, and not just think strawberries only come from the supermarket and don't actually grow out of the ground. So really, really important. Additional benefits, It limits the way we spend funds that are only on local produce and go directly to farmers. And now is the right time. I'm speaking on behalf of over 300 partners across the state, and they are all behind us, and they build local coalitions to be able to support these programs and help get information out about them as well. So this bill is a triple win, both for the economy, for our people in New Hampshire to improve health, and as well as our farmers. And I'm happy to take any questions.
Thank you. Questions? I see no questions. Oh, yes, go ahead.
Thank you, Chairman, and thank you for taking my question. Do we know if farmers are interested in this bill passing?
Thank you for the question. I do know that we looked at this legislation last year, and we did have testimony last year. The turnaround on this was a little quick, and we weren't able to bring any farmers. I have heard testimony from farmers in the past that participated in this program and saw it as a huge detriment to lose it when it did get sunsetted in the past.
Okay. Other questions? See no other questions, so thank you very much.
Thank you.
Also signed up to testify is Eileen Liponis from the New Hampshire Food Bank. You have 3 minutes, ma'am.
Thank you. The testimony I'm passing out is from a colleague of mine who can't attend because she's down in the Education Committee. Hopefully the Farm to School bill is passing, so we have more fresh fruits and vegetables exposure to our children. And that's the main reason why I'm here. This is multifaceted in our approach that the New Hampshire Food Bank has to increasing the exposure to New Hampshire fresh fruits and vegetables to our population. Children learn what they live, and when they learn at a young age the appreciation for fruits and vegetables, that's going to carry them throughout their life. And we know if they start young, they're going to lead a healthier life. So our approach is multifaceted, like I said, and this is one of them. We also operate Granite State Market Match and Double Up Food Bucks. Those are 2 SNAP incentives. So this is also a way, I think, if a WIC participant is also a new SNAP participant, they could find out about these incentives as well. So there's more incentives to bring them to the farmers market if they're also a SNAP recipient, which likely is happening if they're a WIC recipient. So Double Up Food Bucks, that operates in the grocery stores. To answer your previous question, it does not require that the produce is local, but they can get double their SNAP value for produce purchased in the retail environment using Granite State Market Match. Double Up Food Bucks. Granite State Market Match operates the same way, but in the farmers markets and at the farmers stands. So they are equipped at the farm stands because of these 2 incentive programs. So it should be relatively easy for them, the farmers, to participate in this WIC program as well. It's really about children learn what they live. I'll just tell you a quick story. When the New Hampshire National Guard was with us at the food bank during COVID, I had an opportunity later, years later, to run into Lieutenant Colonel Gagnon, and he stopped me and he said, "You taught me something, and I'm never going to forget it." And I asked him what it was, and he said, "I was expressing my frustration to you about people in the fast food line at McDonald's loading up their grocery carts with frozen pizzas. Why aren't they giving their kids the food that they need?" And I said, what if that's all they know? What if they grew up like that and they didn't have that exposure? They don't know. This is what you're giving them, that exposure for a healthy lifetime, so that this becomes a part of their expectation in their diet. I deserve and I expect fresh fruits and vegetables. That's what we're trying to do, and this is just one small part of it that we hope you can support. And any federal program that helps feed our New Hampshire food insecure. We have 180,000 kids enrolled in school. 12% of them are food insecure, so that's 21,600 kids. We need to get to them as much as possible, and we're doing the best we can, and we hope you support us as well. Thank you.
Thank you. Questions? Yes, Representative Weber.
I'm still trying to clarify about the farm stands. So the other 2 programs are available at farmers markets
Granite State Market Match is available at farmers markets. Double Up Food Bucks is available in the retail grocery stores that participate.
Okay, so none of those, neither of those are direct farm stand, they're farmers market programs, is that
They're
correct?
also redeemable at farm stands.
Okay,
the SNAP
and
incentives.
are there participating farm stands?
Oh, yeah.
Okay, that is exactly what I needed to know, thank you.
Other questions? Yes.
Thank you, Mr. Chair. I'm not sure if this is a question for you or someone else, but what happens to the money if it's not utilized?
I can't imagine it's not going to be utilized, I'll be honest with you. I think it would go back to the general fund, but that's, I'm not the parliamentary procedure queen here.
Other questions? Yes, Representative Kofalt.
Yeah, so you said that there are already vendors participating in that program. So am I to understand that they would not need to requalify, that they would essentially automatically already be able to serve as vendors for this?
I can't say that, only if
Okay.
the, whoever they are set up with Double Up Food Bucks and Granite State Market Match made that, you know, kind of like if you're on Medicaid, you can automatically get free and reduced lunch. We hope that passes as well. But, you know, same type of thing. If that could be made very easy by the department. But that's not something that we do.
Okay, thank you.
Representative Nagel.
Thank you, Mr. Chairman. Thank you for taking my question. I have a question about the dollar amount. The $30, that's per season, correct? Is that more, I'm thinking from the consumer point of view, is that more of a symbolic dollar amount, or will it have a real nutritional change for them?
I think it will have a real nutritional change. I think historically it was much lower, and, you know, 30 is a pretty good amount. And that's what I pay for my produce boxes that I have coming out of a regional cooperative. So I would imagine that they would get probably, given the percentages, probably maybe 10 pounds.
Other questions? Representative Merchant.
In the thank you, Mr. Chairman, also taking the question. In the program you're talking about, is there, like in a farmer's market, to minimize the administrative burden to the farmers and also the technology, can they work together collectively so you have a central place to pay for everything versus every single farmer having to have a license? Maybe it's not your question, maybe it goes back to the department, because if you got 10 or 12 farmers there that are selling their produce and fruits and so forth, administratively having one central place to pay things would be a lot simpler for the person paying it, plus also for those who are there. I'm just trying to find a way to minimize it. In your program, can you have one application covering multiple farmers, or do you have to have their own application, their own software?
But that's not a program that we run, so I can't answer that question. There are farm hubs that do that collectively. Could a participant go to a farm hub? And that's a good question. There might be somebody in the audience that can answer that. But there isn't a way, and that would create administratively, you got to figure somebody's got to be taking all these transactions in and then paying them all back out, as opposed to the farmer just getting it done right then and there. I think administratively, it might cost a lot more than it alleviates.
Okay. Yes, Representative.
Thank you, Mr. Chairman, and thank you for taking my question, Ms. Laponis. So I was taking notes, and I'm a little confused. Can you please reiterate what the Granite State Market Match at Farm Stands program is and does, and how it operates, and how
Sure.
that dovetails with what's on the proposed bill?
So if you are a SNAP recipient and you have $20 worth of SNAP redeemable food stamps, that money is matched in the farmer's market. So you can go to the farmer's market and get another $20, and that can be spent there at the farmer's market. Same thing with Double Up Food Bucks, but in the retail environment for those that participate. So it doubles your buying power if you're going to buy fruits and vegetables.
Okay, follow up.
Apologies. How is that different from what's proposed? Is it just that that's WIC specifically, or is there?
Right. This would be WIC specific, and the other one is SNAP specific.
Other questions? Did you have your hand up earlier? No, okay, I'm sorry. Other questions? Okay, I think that's it. Thank you very much.
Thank you.
And the last person signed up to testify Morgan Morani from the Seacoast Eat Vocal. Oh, is it Eat Local? I'm not sure. of that. Oh, okay. And we did receive her written testimony. That was just passed around, so we appreciate that. Anyone else wishes to testify? I have no one else signed up. Seeing none, I am going to, I'm sorry? Oh, yes, go ahead, Representative.
Thank you for taking my question. Would it be in the interest of this legislation to add the word farmers markets in the end of line 7 and the end of line 8?
Representative Weber.
My proposal, Representative, was to, on the end of line 8 and on line 7, to add or farm stands after farmers markets, which is already in there.
Okay.
If that is acceptable to you, or even if it isn't, I'm going to get an amendment and bring it to the committee. The committee can do what they please.
Well, my question to you is, would you like me to go downstairs across the street and have or farmers or farm stands added in both of those places?
If you would like to do that, be my guest. I was going to go ahead and do that, but it doesn't matter.
I'll let you, and then you can bring it forward tomorrow to the committee.
Okay.
And Representative Merchant, you had a comment?
A comment, if
question?
I may. Looking at the federal reg, the definition of a farmer's market does include roadside stand.
Ah, that may answer all of our questions. Thank you.
Okay.
If it's already in there, we're both off the
We're
hook.
both off the hook. Thank you very much. Thank you, Mr. Chairman.
Thank you, Representative Wolf.
Thank you.
Seeing no one else to testify on HB 574, I am going to close the public hearing on this bill and move on to HB 565. I am going to open the public hearing on HB 565 and recognize the prime sponsor, Representative Murray.
Good afternoon. Honorable colleagues, for the record, my name is Megan Murray. I represent the towns of Amherst and Milford. I come to you today speaking about postpartum Medicaid expansion, HB 565. Before you simply asks for an extension, one going from 60 days where we already that we already provide coverage under Medicaid supplemental support to a full 12 months in benefits post-pregnancy to those most vulnerable in income and circumstance. I'll cut to the chase. Funding has been available and is already allocated at the federal level. All we have to do here in New Hampshire is act. The bill is an effort to address what we know and spoke to in data last term regarding postpartum Medicaid expansion, whereby a small yet very important population of those post-pregnancy are left with a gap in coverage and, frankly, access to care. I'm simply asking that we move the coverage from 60 days to 1 year to ensure that our Granite State moms and babies have the best chance that they can at early intervention and success. It benefits us all. Though I was lucky enough to have insurance myself in all 3 of my pregnancies and did not utilize Medicaid, I think about how many inequities exist due to lack of reimbursement or coverage for those seeking and needing support post-pregnancy throughout the Granite State. I personally had a spinal fluid leak and an epidural gone awry that resulted in months and months of physical therapy and care. My posture today is a reminder of what went wrong. I was treated ultimately for postpartum anxiety, though I never knew it existed. More on that later. And so I didn't know what I was looking for when I was at the doctor's. They would often ask about the baby blues. They would often ask if I was sad or had all of those sorts of feelings around that. But what I was never asked was about anxiety due to what I experienced in complications with the spinal fluid leak, 2 blood patches to repair the leak, and a cellulitis infection afterwards. Now, imagine that same circumstance where a mom, and that was 9 months post-pregnancy that was identified. Now imagine that same circumstance where a new mom's 60-day postpartum Medicaid coverage has run out. What then? Where do they turn? Or do they, like every parent, trudge on the best they can, regardless of their unmet needs? There can be a myriad of health issues experienced in the weeks, days, and months after giving birth, whether it's needing a little bit of extra support with lactation or support in recovering from complications or any other need related to post-pregnancy, like mental health care. There are income aside, the issues themselves don't discriminate, and the ability to access care is the burden, and early intervention lowers the overall cost of care. Studies show that investing early in healthy mothers and babies yields healthier communities and families. I think about roughly the 1,000 pregnancies and children whose lives would be positively impacted should they be able to receive an extended term of care for a full interrupted 1 year here in New Hampshire, and know that it's crucial to our success and theirs. So with that, I'll happily take any questions.
Got me in the middle of a sip here. Thank you. Any questions? Yes, Representative Shapiro.
Thank you, Mr. Chair, and thank you, Representative. And sorry if I missed this and you already said it, but how many states have taken this option?
That's a great question. I think somebody in the department who is probably watching this at a closer level may have a great snapshot of what other states, but I do know that it is moving forward in many states across the country.
Thank you.
Other questions? Yes, Representative Merchant.
Thank you, Mr. Chairman. Also, thank you for taking the question. This is all predicated upon them still being eligible for Medicaid. So what happens when they fall off Medicaid? You know, the 12 months you're talking about, correct? The 60 days, it's all predicated, if I understand this correctly, through medical assistance, only if they qualify for the medical assistance in the first place. So after 3 months or 4 months, if they no longer qualify, does that terminate this coverage?
I believe that it is an extension of the Medicaid. So if they, and I'll let somebody
Okay, thank
behind
you.
there speak more to the
State
specifics of
Medicaid Director is
qualification.
coming up next.
Yes.
Other questions? I'm seeing no other questions, so, okay, thank you. Next signed up to testify is Henry Lippman and Rebecca Ross from the New Hampshire Department of Health and Human Services. Sure, thank you.
Thank you, Mr. Chairman, members of the committee. For the record, Henry Lippman, the state's Medicaid director. The department's in support of this legislation. Some of you who were on this committee last year may remember that you took this up as well. I would like to, I understand this bill may also be being exec tomorrow, is that correct?
I believe it is.
They're all noticed, but it doesn't mean that we need to have a final disposition on any of them tomorrow. They can be recessed.
The Consolidated Appropriations Act at the end of this past year that was passed by Congress, which also covered the issue of the end of continuous enrollment under Medicaid, also made permanent. You may remember last session, possibly you didn't, if you weren't involved in it, there was a 5-year window in which this extra FMAP federal match was available. This now makes it permanent. So I think just in the bill, updating the citation to the current law on that would make sense. And I think that if you need it for tomorrow, that could be easily accommodated. And then the second thing is, you may recall last session, the legislature enacted a 25% increase in the rates for hospitals delivering babies, as well as ones for birthing centers. So the department, I think, in an updated fiscal note would have, instead of 200,000, would have 300,000 to reflect that there was that rate increase that occurred for delivering babies subsequent to last year's legislation. I'd be happy to answer any questions, and my colleague Rebecca Ross here can talk about maybe the clinical aspects for children and their moms.
Ms. Ross, would you like to speak, and then we can direct questions to either one of you, or?
Yeah,
Yes, thank you, Mr. Chair and members of the committee. For the record, my name is Rebecca Ross. I'm the director of the Bureau for Children's Behavioral Health. We too are here in support, as well as the entire Division of Behavioral Health. With regard to this bill, it would be critical to supporting the work that we're doing with early childhood mental health, which we know focuses on the parent and caregiver in order to ensure the physical and mental health of that parent or caregiver during the first year, to reduce exposure to ACEs and trauma, and avoid a lot of what we're seeing later in life. So through the system of care work, we've increased the early childhood infant mental health programming and enhanced care coordination, and much of that work is reliant on that parent or caregiver also receiving the support and care that they need during that critical time. So we support the bill and hope that you support it as well.
Thank you. Questions? Representative Weber.
Just, would it be, do you have that citation with you now, or is it something you have to get for us? And if so, would you be willing to either pass it up or I'm seeing nodding heads, so.
Sure. Robert Berry, who, thank you for your question. Robert Berry, who's counsel for Medicaid, I think can look that up and provide that to the committee.
Thank you.
Representative Leon.
Thank you, Mr. Chairman, and thank you for being here. We have some questions around whether this is a continuation of coverage without an eligibility determination, or if this is only for eligible families. So could I ask that, and then I'll follow up, since I think that was clarifying Representative Merchant's question.
Thank you for the question. So an individual who is eligible for Medicaid, ordinarily, who's delivered a baby, would have just 60 days more of coverage to take care of their health care needs. Typically, what this would then do is just extend that from 60 days to a year. So they're under Medicaid for all eligibility groups. If you have a change in circumstances, you're supposed to report that, and that could, but generally, someone who remained eligible would have that eligibility for the whole period. And I think the estimative number of women that we had, was between 561 or so and 760 or so. It's not a lot of in terms of the entire population of the Medicaid program. It's not a huge number of people. That's why the number to cover them is not otherwise, because some people are able to pick up coverage through other sources, either through the Medicaid program or outside of it.
So in clarification, then, those 560 to 760 women, those are women who were eligible when they were pregnant. They lost eligibility around that 60 days. So, sorry. You guys were well ahead of schedule. Okay, so I see the nodding head. Would these women otherwise be eligible as a changing circumstance to apply on the health marketplace as well, to have access to continued care?
If they fell into that criteria and applied, then they would be able to potentially access that. But there are, if you think about someone who is maybe taking pregnancy leave, they may not have the income to be able to qualify for another program.
Sorry, and just the last follow-up, if they're on leave, wouldn't they qualify for continued Medicaid eligibility because they're don't have income?
Well, that would probably be true as well, yes.
Thank you.
Other questions? Representative Weber.
Well, those questions lead me to ask for a clarification. So now we understand if somebody qualifies for Medicaid, they get 60 days worth of postpartum benefits, services. So after the 60 days, am I right in thinking they still qualify for Medicaid, but they are simply not qualified to receive specifically postpartum benefits? Or have I gotten that backwards?
It's not, it might be helpful to say there are different eligibility groups. Pregnant women is a specific eligibility group.
Okay.
So that eligibility group has Medicaid coverage only till 60 days postpartum. And that's the issue, it's not general Medicaid, it's the eligibility group of pregnant women.
So it's outside of the economic guidelines for the traditional Medicaid?
Yes.
Okay, thank you for clarifying that.
Other questions? Representative Nagel.
I'm just, thank you for, Mr. Chairman, thank you for taking my question. Why 12 months?
So generally, Medicaid eligibility spans, you have to redetermine your eligibility every 12 months. I think it's just making it consistent with that. We've had the exception to that since March of 2020 because of the federal public health emergency, but all individuals have to, that are in the Medicaid program, have a 12-month span. Again, the only exception to that is if there's a change in circumstance that they need to report.
Representative Murphy.
Thank you, Mr. Chairman, and thank you for taking my question. It's just, I'm trying to, so up to 60 days they have coverage.
Yes.
With this, they go to 12 months. And I'm trying to understand the delta between 2 months and 12 months as to how many patients are, have you been able to figure out how many patients are actually, or postpartum women are actually going to be impacted by this?
That was when we were, thank you for the question. When we were talking earlier about the range, because every year the birth rate is different, but I think we generally would see a range about between 560 to 760 based on historical experience on an annual basis. And again, that's why, excuse me, I think the fiscal note in terms of what the cost is not maybe as large as you might otherwise think. It might be, but it's a relatively small group of women who end up in this situation, but meaningful to those families.
Just a quick follow-up.
Follow-up?
Just, thank you. So I'm just, is there a breakdown of the needed services that occur from like that 2 month to 12? I'm trying to understand, is it postpartum depression? Is it whatever the other issues are? Do you have that data broken down for that group of people?
In terms of putting together the numbers for actuarially.
The diagnoses that they come in with?
So things like postpartum depression is a key thing. Again, if you think about making medical appointments these days, it's very hard to get everything possibly done. It may be an infection, it may be a cardiac situation, it may be diabetes. Those I think are they're more commonly medical or mental health, could be substance use disorder too, that they'd be getting assistance with, and just getting that all done within 60 days is very hard to do.
Thank you.
Other questions? Representative Leon.
Thank you, Mr. Chairman. Would it be possible for you to provide the committee with the information about the eligibility criteria for pregnant women and for other people so that we can understand what the differences are?
Sure.
Thank you.
Other questions? I'm seeing no other questions. Okay, thank you very much.
I have the citation if I can hand it to someone.
Sure. Thank you. Okay, also signed up to testify is Bob Dunn, representing the Roman Catholic Bishop of Manchester.
Good afternoon, Mr. Chair, members of the committee. It's good to be back in front of the committee. I'm Bob Dunn, and I'm the Director of Public Policy for the Roman Catholic Diocese of Manchester. And on behalf of Bishop Labashi and the diocese, I'm here today to speak in support of HB 565. I'm not sure if this got covered yet today, but the reason we're sitting here is because of the Committee of Conference last year, just to sort of refresh memory, because the policy decision about extending postpartum benefits to 1 year was approved by this committee and then by the full House and also by the Senate, but then it got wrapped up in Committee of Conference. So this is sort of bringing back a bill that I think was looked at approvingly last year. This is a policy issue. This extension to 1 year is a policy issue which is supported by Catholic bishops around the country as a pro-life measure. And I think that it's pretty clear that when you think about whether a bill like this advances the common good, that it does, And we always keep coming back to the common good and human dignity when we look at bills. And that's not just a religious thing, but as you know, Part 1, Article 1 of the New Hampshire Constitution says that government is instituted for the general good. And so, you know, the family is the keystone of our society, right? We would all agree on that regardless of our political perspectives or persuasion. And there's really few ways that we could better support families than by supporting and prioritizing the needs of mothers and babies. And I keep coming back when I think about this bill to the fact that for those you know, relatively small number of people that are being impacted by this initiative, each one of the mothers and each one of the children that are involved that benefit from this legislation and from this law is one more mother, one more child that is undoubtedly going to have a better future than would have been the case otherwise. So that's why we think this bill is such a good idea, and we'd ask you to vote in favor. Thank you.
Thank you. Questions? Any questions? I see no questions. Okay, thank you.
Thank you.
Also signed up to speak today is Nancy Vaughn with the American Heart Association. You have 3 minutes, ma'am.
Good afternoon, Chairman McDonald, Vice Chair Leon, and members of the committee. My name is Nancy Vaughn, and I am Government Relations Director for the American Heart Association here in New Hampshire. I have passed around written testimony. Attached to that is the American Heart Association's fact sheet on maternal health, which goes into more detail than I will do in my testimony today as to why we support this. But we do support this, this policy. The American Heart Association recognizes that this is a leading cause of death for new moms in this country. 1 in 3 postpartum pregnancy-related deaths is due to cardiovascular disease. So it is a policy that time has come to pass and get this into law in New Hampshire. The American Heart Association is working in general on maternal health issues. Women and heart disease has been a big issue we have been working on for many years. And with maternal mortality rates as they are, by working on this issue, we hope to improve the cardiovascular health of women and prevent death that is happening. So Medicaid, the Medicaid program plays a real important role in maternal health and perinatal outcomes. And timely postpartum visits, which gets to some of the questions that were just asked, provides an opportunity to address health issues that may not have been known to the individual prior to her pregnancy, but is now, and also any pregnancy-related complications that have arisen. Many of these complications we don't see in postpartum moms from like 41 days on out to the end of that first year and a little bit beyond even. So that is why the 12 months is something that's very important to us. It is a time for having regular appointments. If a sudden appointment needs to be made, there's time for that, where in 60 days you just don't have time for that. For conditions that we hope to get managed, treated, overcome so that it does not result in more serious illness down the road, particularly once they may find themselves no longer insured. Then they won't have access to health care except for if they were paying out of pocket for this, or it comes down to hospitals and healthcare providers having to give unreimbursed care for these patients. So I'm not going to repeat what others have said before. If you do have any questions, my email and phone number is on my testimony, but I will take any questions and hopefully be able to answer them for you.
Okay, great. Yes, go ahead. Seth King.
Thank you, Chairman McDonald. Thank you for being here today. You weren't here earlier, I don't believe, but we were learning about another bill, and which had a topic similar to what you're referring to, and that is postpartum or deaths within 12 months of maternal mortality. And one of the witnesses testified that there's roughly 11 deaths annually in the state of New Hampshire, but she also specified that those are basically almost all drug-related deaths. Do you concur with that?
I believe that there's also within that number is about 5 maybe that were cardiovascular related as well. But yes, in New Hampshire, it might be a little different than what we're seeing in the rest of the country. And again, I just believe that addressing substance abuse issues, if that is what the problem is very important for their cardiovascular health as well as just saving their lives and helping them go on to being moms to their children.
Other questions? Yes, Representative Weber.
Thank you. And if you know, do you have any estimate comparing the number of cardiac deaths with the number of people who need treatment past 60 days, who don't die, but who have conditions, whether it be heart, cardiovascular, whether it be substance abuse, whether it be diabetes, that still require treatment?
Right. I don't have exact figures on that, but what we do say within the materials that I had distributed is that we believe 1 in 3 we know die from cardiovascular disease. We believe that 2 of those 3 deaths can be prevented, and so that would cover all of those issues. Yeah, thank you.
Other questions? I see no other questions. Okay, thank you very much.
Okay, thank you.
Also signed up to speak today is Holly Stevens from NAMI, New Hampshire. You have 3 minutes, ma'am.
Good afternoon, Chairman and members of the committee. My name is Holly Stevens, and I'm the Director of Public Policy at NAMI New Hampshire, the National Alliance on Mental Illness. NAMI New Hampshire is a nonprofit grassroots organization whose mission is to improve the lives of all people impacted by mental illness and suicide through education, support, and advocacy. And I'm here today representing NAMI New Hampshire, speaking in support of House Bill 565. The United States is the only industrialized nation where maternal mortality is on the rise. And there's an increasing number of maternal deaths that are occurring in the postpartum period. Data from the Center of Disease Control and Prevention show that about 1/3 of all pregnancy-related deaths happen 1 week to 1 year after pregnancy ends. And getting to something that one of the representatives mentioned about, data within New Hampshire. I couldn't find the 2022 annual report on maternal mortality, so I've got the 2021 report that has 2019 data in it. But according to that report, half of the deaths, there were 8 of them that year, occurred in the 6 to 12 month range postpartum. So it would have occurred after this 60 days would have ended if these folks were on Medicaid. And just to that point, 4 of those deaths were overdose, 2 of them were suicide, and 2 of them were medical causes, which is why NAMI New Hampshire has a strong interest in this bill, because a lot of the mortality that happens with our women who are postpartum is substance use and mental health related. Additionally, one of the most prevalent illnesses facing postpartum moms is depression. According to America's Health Rankings, 11.2% of New Hampshire women with a recent live birth reported experiencing depressive symptoms. So I think that gets to somebody's question about, data regarding some of these illnesses. So that's 11.1% of New Hampshire moms are experiencing some sort of depression post-birth. We also know that the children of women who experience postpartum depression are affected. Research has demonstrated that there's an association between postpartum depression and delayed cognitive and language development, disorganized or insecure attachment, higher rates of behavioral problems, and lower grades. There's also a documented link between postpartum depression and higher rates of depression in children when they become teens. So for these reasons, the strong mental health connection between women who have just given birth and also the connection to their children later in life, NAMI New Hampshire strongly supports this bill.
Great. Thank you very much. Questions? Representative Weber.
So is it fair for me to conclude that whatever we spend now on maternal and child health in that first year is going to save us money down the road in terms of additional mental and physical health issues?
It will save money not only for the mom, but for the child as well.
Thank you.
I don't have return on investment figures, but yes.
Other questions? Other questions? Okay, I guess not. Thank you.
Thank you.
Last person who has signed up to testify on this bill today, Mackenzie Nicholson from Moms Rising.
Good afternoon, Chairman McDonald, members of the committee. Thanks so much for taking the time to hear my testimony today. I won't keep you too long. I know we've heard a lot today. Plus, there's a cute little baby in the room that we're all gooing and gawing over. So my name is Mackenzie Nicholson. I'm the Senior Director of Moms Rising here in New Hampshire, an on-the-ground grassroots movement representing tens of thousands of moms in the Granite State. I want to share a little bit about my story, which is that when I had my first child, those first few months we came home from the hospital were some of the hardest of my life. Stresses with a colicky baby who really didn't want to have any of the formula that we had to give him. Not to mention added financial stress. It was a really hard time for me. But luckily for me, I was covered by New Hampshire's Medicaid program. We fit the eligibility criteria for the program, and it was hugely helpful. But pregnant people and birthing people in New Hampshire are directly impacted by Medicaid, with 1 in 4 births in the state being covered by Medicaid. Women and birthing people, to your question, Representative, often experience a lot of pregnancy-related complications that extend beyond 60 days postpartum, including for things like hypertension, mental health struggles, gestational diabetes, things like that that require attention for longer than 60 days, not to mention getting an appointment. Our current state law only allows for that 60 days of coverage. Another very sad and, scary fact is that the United States is one of the most dangerous places to give birth in the developed world, with major racial disparities, especially affecting Black women who lose their lives at 3 to 4 times the rate of white women. And that's separate from age, economic background, or education. And a recent CDC report that I looked at actually showed that about 80% of those maternal deaths are preventable. And that same report shows that 53% of maternal-related deaths occurred between 7 days and 1 year postpartum. As a mom that struggled with my own postpartum depression, I'm hopeful that we are able to pass this extended coverage in New Hampshire. looking back, if I had known that I would have had access to continuous healthcare coverage, I would have been able to focus on recovering from a C-section, which is a major surgery. But instead, I was thinking about where am I going to find insurance coverage if my employer doesn't offer it, and worrying about how are we going to pay for those medical bills if they do come up. I was excited when the American Rescue Plan allowed for this extended coverage to, I know, tell me about it, buddy. To answer another question, there are 29 states in the country that have already passed this extended coverage, with 5 others who are working on implementing the policy. New Hampshire is the only state in the Northeast that isn't on that path already. Lastly, the last thing I'll say to you is, in a report for the Texas legislature, researchers showed that coverage that was provided to postpartum women during the pandemic benefited maternal health so hugely that women used twice as many postpartum services after that 60-day period, between 2 and 10 times as many preventative, contraceptive, and mental and behavioral health services, and 37% 37% fewer folks access services related to short interval pregnancies within that first year. And the last couple of weeks in the Northeast has showed us that devastation can truly take place when there aren't safeguards for moms in their postpartum state, and it's hitting close to home. And I, like myself and many other Moms Rising members, are not immune to those crippling effects of postpartum depression. So on behalf of myself, Moms Rising members, we kindly ask you to pass this bill and support pregnant and postnatal moms.
Thank you.
Take any questions.
Questions? Seeing no questions? Okay, thank you. I know of no one else signed up to testify. Does anyone else wish to testify on this bill? House Bill 565. Seeing none, I am going to close the public hearing on House Bill 565 and open the public hearing on House Bill 580. And to begin, I would recognize the prime sponsor, Representative Haken Phillips.
Thank you, Mr. Chair. Thank you, committee members. For the record, my name is Representative Mary Haken Phillips. I represent Grafton County District 12 along with Representative Murphy, which covers Hanover and Lyme. So I'm here to introduce HB 580, which would establish a children's vision screening initiative within the state Medicaid program. The reason why I'm here today before you is because of the problem, which is known as amblyopia, which is a mouthful, but it's sometimes called the lazy eye disorder, and it is the most common cause of vision loss in children, and it occurs in about 2 to 4% of young children ages somewhere between 6 months and 6 years. This is about 2 out of every 100 Granite State children. With this disorder, vision is impaired due to abnormal development of the neural connections between the brain and the eye during early childhood. Primary causes of this are misalignment of the eyes, and it's basically a refractive error. If you want to get into the technical explanation, I'm sure Dr. Murphy could help us with that. Typically, this vision loss affects only one eye, but people with amblyopia are nearly 3 times more likely to develop this vision impairment in their better seeing eyes later in life. So early detection of amblyopia is critical. This treatment is the most successful when initiated before the child reached 7 years of age. The battle to prevent this vision loss due to amblyopia is a winnable battle, as many of our experts tell us, and other countries have definitely made strides towards eradicating this vision loss, as well as other states in our country. Without early treatment, amblyopia can lead to permanent vision loss in one or both of our eyes. So understanding that problem, according to the experts that I've spoken to in our state, New Hampshire is actually one of 9 or 10 states in the country that does not have a government-sponsored kids vision screening program. I'm told that about 25 years ago, the New Hampshire Advisory Council of Vision Screening was established, and it reviewed childhood vision screenings as a public health concern. And historically, there was a push to screen children and their vision at daycare centers throughout the state, particularly in the North Country. It was an example I heard about But my understanding is that since the COVID-19 pandemic, the public health efforts have rightfully so been geared towards fighting COVID-19, and this emphasis on vision screenings had declined across the state. So amongst the reasons for declining screenings beyond that public health focus being elsewhere is that, reimbursement rates here in the state are pretty low, and healthcare professionals' time is extremely valuable. So when they're making those cost-effective analysis about which cases to take, the screenings do not reach that top of their priority list. So anyway, I digress. This bill proposes a limited goal, which is to improve childhood vision screening numbers across the state. So this bill is very limited in scope, and I'm intending to reach the goal of increasing those vision screening numbers by just focusing on children ages 0 to 6 who have enrolled in the state Medicaid program. So we're not talking about all uninsured and insured children, even though that is a lofty goal. We're narrowing down on ages 0 to 6 because screenings before kids enter school is really critical, because you want to treat by age 7 to reverse the effects of this disorder. And if treatment is not administered by that age group, obviously the disability could become permanent. So we're talking a small window of time, so a specific group of children. We're limiting this initiative to special screenings for kids that are not reading at a grade level upon entering the 3rd grade, which is about the same age group that we were just talking about. And also at the request of teachers through a school administrator who notice a lag in the reading skills of a child. This is obviously intended to catch vision problems that become evident after the initial screening for when the student enters the school system. We're also limiting this initiative to reimburse those healthcare providers who are trained and approved by the Department of Health and Human Services, which would include professional pediatricians, Southern New Hampshire Area Health Education Center, who I understand already participate in the state Medicaid program. This section of the bill is particularly modeled after similar legislation on the books here in New Hampshire that leaves the medical experts to do this important work. This bill also limits the initiative only to a screening, which is a relatively inexpensive process to have your pupils screened and to identify a larger, more serious problem. This bill does not include the scope of a more comprehensive, more expensive eye exam. That is obviously a laudable goal as well, but it is not included here in this bill. And the thought is that if a student would fail the screening, they would be referred for that full eye exam later with healthcare professionals who can follow up. This bill also limits costs by paying through Title 19 Medicaid state plan amendments to CMS. So being fiscally responsible, I think that this bill follows along with New Hampshire's strong tradition as being, very conservative with our dollars. And the important thing to note is that this would be federal funded, and we're not looking for state expenditures. Finally, this bill's reporting would be to the state only through a parent's form that they would receive at a screening and then turn over to the local school district. Exemptions obviously are included for religious reasons, or if the child has already received a full comprehensive eye exam within the last 12 months, or if they've already received a diagnosis of permanent vision loss. So the data will be gathered through the Commissioner of the Health and Human Services and then annually reported to the Health and Human Service Oversight Committee under RSA 126-A subsection 13, or colon 13, excuse me. This is similar to other childhood initiatives data that's reported through New Hampshire systems already. So there's no grand depository, no registry. We're not talking about some of the privacy concerns that could go along with a larger, more comprehensive data tracking device related to the screening. That is also not part of this bill. The important thing to note about this is that I have spoken with several stakeholders throughout the state, including New Hampshire Optometrists Association, which I believe their lobbyist is here today, as well as other New Hampshire-based optometrists, ophthalmologists, and pediatricians. Actually, in fact, some of the nation's most leading experts on this issue live in my district in Grafton 12, and I just feel super lucky to have these experts willing to donate their time and talents to advance this cause. I think the main takeaways from my meetings with these groups are that they agree the main goal should be aligned to establish a low-cost vision screening initiative for our state. You know, we've discussed several model pieces of legislation throughout, New England and the Northeast as gold standards that, may be replicable here in New Hampshire, but we were recognizing that the political climate here in New Hampshire is unique and that our model will have to be different than what we've seen in other places. So admittedly, the goals of the NHOA and the physicians that I have spoken with are much more robust than the initiative you see here in draft form. They have three main goals that I see are missing from this bill. That one, they'd like to close the gap between a failed screen and the referral and a completed comprehensive eye exam. So that missing link is not included in this bill, which they would like to see. The second thing is that the group would like to see reimbursement rates for Medicaid increased as well. And the third main goal is that the group would like to formalize some sort of database for tracking those failed screens and how to follow up appropriately. So again, that's outside this bill. I'm trying to keep it simple. But the largest overarching concern I think that was brought to my attention is if you look on page 1, line 8 and 9, as well on page 2, lines 6 and 7, there is a list of the healthcare professionals that are listed, which are required under this law to complete the screening themselves. So the licensed optometrist, physician, PA, or advanced practice RN, registered nurse. So my understanding is that through conversations, lay people, such as school nurses and other trained groups like the Lions Club, can actually administer the screening without requiring more specially medically trained professionals to conduct the same screening. So the recommendation would be for children who have failed screenings to then be referred to this subset of group, this optometrist, physician, specially trained medical professionals for that comprehensive eye exam follow-up. So I think that this is an important place for a possible amendment if the committee is open to that. I know we have wording that could be drafted quickly for those two specific line items. And I understand that the stakeholders that I've spoken with at the NHOA and other physicians groups would prefer to amend this bill rather than start with a fresh piece of legislation. And I hope that the folks you'll hear from after me today will share their personal experiences with their children's screening experiences with you today as well. So in sum, the bill I think is a solid step for the benefit of kids and vision in our state. And I'd just like to say, let's not forget that an ounce of prevention can save us significant funds down the road. The more kids who are screened, referred, and diagnosed early means the fewer state resources down the road to assist them in their communities and their school systems. And I'm happy to request that amendment I spoke about. So this bill could be considered for ought to pass, but if the committee determines that more work is needed to be done, I know that NHOA and my constituents would welcome the committee's retention of this bill so that further input could be taken and more encompassing dialogue could be undertaken to really make this bill something that we could be proud of here in the state. So with that, I'll take any questions you might have.
Okay, thank you. Representative Leon.
Thank you, Mr. Chairman, and thank you, Representative Phillips, for coming and speaking today. This is a really important issue, and it seems like you got a really, really big program into just a page and a half, which leaves a lot on local school districts, possibly a lot to rulemaking authority. I'm glad to hear that you're interested in retaining this because I think that this is going to require a lot. What do you think about offloading this to the local school districts and just how that's going to cost them a lot of time and personnel as well? Is that something you had thought of?
Yeah, thank you, Representative Leon, for the question. So I think the emphasis on returning reporting through the school system is to respect the privacy of our constituents, when they're getting their children screened, to really offload the professional industry from collecting that data, which, may at some point cause, eyebrows to lift of children data being shared from professional offices through a state administrative body. So I think, the common practice, as I understand it, is that when children enter school now, anyway, they're also returning some forms about childhood vaccinations, for instance. So the model of this legislation is to provide a similar form for the screening to just go through the same system that's already established through that initiative. So I think while there will be some administrative burden for local school districts, it's no more than what's already existing in place for the childhood vaccination situation. Thank you.
Representative Weber.
Thank you, Mr. Chair, and thank you for taking my question. If we were to be concerned, as I am, about screening, and then you understand that your child has a need and you don't have the wherewithal to provide for that need, do you know if there is a similar Medicaid state plan amendment available to cover the actual eye examination and then treatment, or is screening the only thing that's available at the moment?
Thank you for the question, Representative Weber. So in my discussion with the folks recently from the NHOA, it's my understanding that Medicaid reimbursements now include coverage of comprehensive eye exams as well as glasses for those follow-up referrals when made. The issue, again, that we were speaking about is the gap between actually receiving the screening and the need for a follow-up comprehensive exam, and then getting those people to that place and getting that exam completed. I think Medicaid reimbursements already cover the possibility of paying out for the additional exam and glasses follow-up, but the issue is we're just not getting all of the steps along the process. So this is my proposed legislation is one way to get the ball moving down the road.
So can I have a follow-up?
A follow-up.
Thank you. So as a follow-up, does this completely close the gap? If we get the screening and a child is identified as needing either glasses follow-up treatment of whatever kind, if they are Medicaid qualified, they then just get that. So the issue right now is that they're not being screened because nobody's paying for screening. Is that the issue?
So thank you.
Or is there another step that I'm missing?
So Representative Weber, you have identified the problem completely. It's a multi-variable concern and multi-step response. And so yes, there is a lag in actual screening numbers. So this bill is getting at that concern, but there is also a lag between children who are screened and referred for more comprehensive eye exams because they're failing the screening, and then making it to that exam and getting a diagnosis. So it's every point along the road you see a fall off. So I'm just trying to get more kids pushed into the screening system so that hopefully more parents become aware and become engaged with the process of moving down that road to diagnosis and treatment.
But there's still going to, I'm sorry.
Yes, the short answer is there is a gap.
Okay, thank you.
Representative Merchant.
Thank you, Mr. Chair, and also thank you for taking the question. This bill, as I read it, is really targeted to Medicaid children. I don't think the disease that we're talking about is restricted to them. My concern is how do we attack the greater audience, because trying to identify children early on with the issue is critical regardless of the payment source. So given the fact that most schools have a school nurse who I heard could possibly do this exam, it's a basic screening, could we not have in kindergarten or even preschool have them perform the exam and then at that point in time identify the children who need to be referred to a professional to do a comprehensive exam and not have to burden the state Medicaid system with the screening process, but taking care of what they already take care of?
Thank you, Representative Merchant, for the question. I think, yes, I think your inclination for a more robust program falls in line with many of the state's optometrists and ophthalmologists and physicians, pediatricians' wishes that, you know, every kid would be screened coming into every school situation, but that's not the scope of this bill because we're trying, the reality that I'm confronted with is that I don't think there's political will in our state to reach that large of a program at this moment in time. So my targeting of this bill to just the Medicaid group of children, it was because I really think that these are the most vulnerable kids in the system, and you know, trying to help them and their families through this process is, you know, a good place to start. But obviously school nurses, as you brought up, are totally capable of providing this screening at daycare centers or at young K-5 type
Mr. Chair,
institutions.
Follow up.
would you believe one of my young granddaughters had something comparable to this and was caught by the school nurse through a visiting process. We could not understand why she was falling behind in her learning because she couldn't see the chalkboard. So anyways, I want to say thank you for bringing it to our attention. That's my would you believe question.
Okay. Representative Nagel.
Thank you, Mr. Chairman. Thank you for taking my question. I think the critical thing to me personally is points of access here. I see 3 points of access. One is 0 to maybe age 5, which is for kids that are in school, 5 and after for kids that are in school, and then probably early child development programs for kids in the middle. My question is this. I mean, it's been 40 years since I did primary care. But visual screening was part of every well baby check, primary care visit. And what I'm wondering about is, are we not already accessing that group? If we're not, why not? And secondly, if I'm seeing a Medicaid kid, am I allowed to bill extra now because you're adding an extra fee to this thing, to a well baby check?
Oh gosh, I do not have the technical expertise to give you the answer to the question about a wellness baby check, and is there a separate coding item, for instance, related to a potential vision screening. So I apologize. I can do some research and get back to you with a follow up on that, Representative Nagel. Yeah. Oh, I wanted to answer the first part of your question though. It was, I'm sorry, could you please remind me?
There were the 3 points of access
Yes.
to care. But school doesn't come till quite a bit later. So how do we hit these kids earlier? Like, if we're going to allow personal things, my sister was diagnosed with amblyopia at age 2. She had surgery at that age, and she's got perfect vision because of that. She's now 70 years old.
Yeah. Well, that's a great success story. So to answer your question, my understanding is that the diagnosis can be caught at many various stages of children's development. It may not be caught at that first wellness check or the 2-year-old wellness check, but that it could be caught later as well. I think that's why the 3rd grade reading level special screening initiative was also thought of, because it could be kind of an after. The disorder could be developed later than upon entry of school. So I hope that kind of answers the question about the 0 to 6 age group screening access. The other thing I'd like to say to your earlier question is that, my understanding is that pediatricians do a lot of these screenings in their offices right now as primary care physicians for children, and that, that is one of the reasons why the language that you see on page 1 and 2 in those 2 lines came up, is because actually the first person to bring this subject matter to my attention was a pediatrician here in the state of New Hampshire who administers a lot of these screenings and has written several scholarly articles about this exact issue. So I think it is the work of physicians and offices as well as the school nurses in our school system. So there's plenty points of access, of course, to be tapped, I would say.
Okay, thank you. Other questions? Yes.
Yeah, thank you, Mr. Chair. Thank you for taking my question. So can you explain a little further what you mean by, I heard you say it before, maybe clarification on there isn't the political will to have this done by schools? What do you mean by that?
So we are very closely divided legislature, as you'll note. So I think, to have a very robust system where we're asking every school-age child to have a completed screening, whether regardless if they're going to public school or private school or, daycare centers. I don't think that there's going to be, 400 out of 400 state representatives who agree with that program. I would love that opportunity. I just don't think that's a realistic expectation for our House. And then I know the Senate chamber has their own dynamics. So I just think that that's a term we use in political science. Political will is the likelihood of a bill going from concept into law, and you need the motivation behind the idea to get it through the process. And by saying I don't believe there's a political will to get it across is what I'm trying to speculate, that I don't believe the largest program that will benefit the most kids in our state with the largest Medicare reimbursement rates instead of Medicaid, I don't think that's possible at this time. So I'm really trying to limit the scope to something that I think is possible.
Okay, thank you. Other questions? Yes.
Thank you, Mr. Chair, and thank you for taking my question. Just a quick point of clarification. As I read the bill, I thought for the 0 to 6, that was Medicaid eligible only, but I thought that the screenings upon entry and at the 3rd grade reading level, that was everybody, not just Medicaid eligible. Am I reading that right, or am I missing?
I think you are reading that right, Representative. Thank you.
Thank you.
Yes.
Thank you, Mr. Chairman, and thank you for taking my question. I'm wondering, is this similar to the system that exists for hearing screening for children, where newborns are screened and then if they need to, they get then diagnosed by someone who's more of a hearing specialist, and then they're, if they're under 3, put and sort of followed and eligible for services through family-centered early supports and services, or through the DOE if they're 3 to 6. So I'm just wondering if it's a similar structure that where they, because if you screen children, if you screen people, what are we going to do about all the people who don't follow up, is what I'm wondering.
Thank you, Representative, for the question. To be specific and to point of your question, I am not aware of the hearing screening, so I can't speak to the similarity of the programs, but what I can tell you is that this legislation is modeled after a best practice out of Massachusetts that has a really comprehensive, much larger program and more robust program than what I'm suggesting. For instance, they do have the follow-up mechanisms built in for the comprehensive eye exam referrals and the follow-up that would take place, including data tracking. So again, that is not what I'm proposing, but this is the first step of that model legislation, so that if political will does increase in the future for a more robust program, we can build on this starting point and try to, build that out, that infrastructure out.
Okay, thank you. Other questions? Seeing no other questions? Okay, thank you very much. Also signed up to testify today is Representative Megan Murray. You have 3 minutes, Representative.
Thank you very much, honorable colleagues. Again, for the record, my name is Megan Murray. I represent the towns of Amherst and Milford. I come to you with a little bit of an anecdote regarding some services that are provided with regard to early intervention screening within my the district that I represent. Both the towns of Amherst and Milford have Lions Clubs, and both of them have recently acquired these goggles of sorts that are early vision screening. They're quite expensive, I had learned, and they're somewhere over $800 to $1,000 per set of goggles. And so through their charitable works, they are having breakfast opportunities for these kiddos free of charge to be able to go and sit and have the opportunity to get a screen, so to speak. It is not something that is a definitive medical diagnosis. It is something that simply says, hey, something's not right here. We would like to flag for you that you should probably get an additional doctor's appointment with an optometrist or an ophthalmologist. There's no real indicator of what the issue might be. Moving forward, we attended one such event when my daughter was really, really young. She was 3 years old, and I had initially sent my son up there to have the goggle screening. He passed it, everything was fine. My daughter at 3 years old sat there and did the goggles, and she failed it. And it ended up catching a pretty severe astigmatism. We had noticed behavior before. We thought it was toddler related. She would trip occasionally. Depth perception issues were a little bit, I would say, more pronounced than her brother. And it turned out that she, in fact, has a severe astigmatism that was caught super early on. And so while those other organizations that do provide that opportunity for such services like this are out there, they are expensive to acquire. And so I think that this early intervention program is also crucial to making sure that those who need the care and the access to the care have it. So like you were, Representative Nagel, were mentioning, points of early access I think are crucial, and whether it's through nonprofit organizations or through a requirement for continued screening to expand the Medicaid services, I support the bill and the intent of the bill. I understand there may be some work, but I am happy to help work on that with folks should you need that. Well, I'm happy to answer any questions.
Okay. Any questions for Representative Murray? Seeing none? Okay, thank you very much.
Thank you.
And the final folks signed up to testify on House Bill 580 are Henry Lipman and Rob Barry from the Department of Health and Human Services. You've asked for 5 minutes. Anything under that would be much appreciated. I know there's 2 of you, though.
I think we can do it in 3.
Okay, great, thank you.
So I think the suggestion to refer this for further work and to stay within the 3-minute time limit, there are some issues that related to who can bill Medicaid in terms of having to be qualified treatment providers that would need to be sorted out. The list that's in there of the professionals licensed by the Office of Professional Licensure would be qualified to bill. There's also the school setting that's been discussed. We do have a Medicaid school program in the state. It's run on an individual district basis. I do think that I personally benefited from this issue myself as a kid. I was running into walls and my parents trying to figure out what was going on. So we would be committed to working with a work group on this to figure out what is the solution or solutions in New Hampshire, because different school districts, different communities may, based on their resources, have to approach it differently. But I think the goal of this legislation is the right and correct goal, and the personal experience can support that.
I have nothing further to add in interest of the of time.
Okay, well, thank you. Any questions for these gentlemen? None? Oh, wow.
Mr. Chairman,
Yes.
on the earlier bill, in terms of the pregnancy-related eligibility criteria, I emailed the committee some information on that, so hopefully that answers that question.
Okay, thank you very much, gentlemen. Okay, anyone else wishing to testify on House Bill 580? I have no other cards, no one else signed up. All right, I am closing the public hearing on House Bill 580, and I am opening the public hearing on House Bill 282. I am going to recognize the prime sponsor, who is also a member of our committee, Representative Joe Shapiro.
Thank you, Mr. Chair, and thank you, colleagues, for allowing me to introduce House Bill 282. For the record, I'm Joe Shapiro, representing Cheshire 16, Keene Ward 2, Alstead, Gilsum, Harrisville, Marlborough, Marlow, Nelson, Roxbury, Stoddard, and Sullivan. It took me a long time to be able to say all of those. This is a simple bill, albeit a difficult one to understand if you were just to read the text. It will increase healthcare access to a small group of lawfully residing New Hampshire residents. In 1996, the Personal Responsibility and Work Opportunity Reconciliation Act was passed, a federal act, and this was under President Clinton, and this was commonly referred to as the Welfare Reform Act, and among other things, it created some obstacles to people obtaining federal benefits. So in particular, to this bill, it created a 5-year waiting period for certain lawfully residing immigrants before they could apply for Medicaid. That's the bad news. The good news is that in 2009, the government created an option for states to eliminate that 5-year wait for children and pregnant women who are lawfully residing in the U.S., but not yet citizens. Each of you should have a map in front of you that indicates that New Hampshire is the only state in the Northeast and one of only 15 states for children and 17 states for pregnant women that has not taken this option. This bill, if passed, will require New Hampshire to amend its Medicaid state plan to provide coverage for otherwise eligible children and pregnant women. And when I mean otherwise eligible, it means that they will have to be eligible by income in order to qualify, just like anybody else who gets Medicaid. Along with my testimony in the aforementioned map, you should also have in front of you the July 2010 CMS guidance to states regarding this option. Among other things, it lists various immigration statuses that are considered lawfully residing. While many categories are included, the largest number of affected people will be those who have recently been granted a green card through family reunification, asylum applicants, and those on temporary protected status. In addition, victims of domestic violence under the Violence Against Women Act and those with a U visa, which I just learned about, who are victims of serious crimes and are cooperating with U.S. law enforcement would also qualify. It should be clear that this bill will result in health care coverage for a small number of lawfully residing New Hampshire residents. It does not apply to undocumented immigrants. It does not even apply to DACA recipients, as they are excluded from the federal Medicaid match. Professor Leighton Koo, director of the Center for Health Policy Research at George Washington University, using data provided by our own DHHS, provided an estimate of utilization and cost. His estimates indicate that health care would be provided to approximately 300 people at a cost of just over $200,000 per year in state funds. The House Bill 282 fiscal note reflects this. Access to prenatal care and regular health care for children is an important investment in public health and will save money through prevention and timely diagnosis. Lack of or delayed prenatal care is associated with low birth weight and multiple childhood medical conditions. When enacted, this bill will reduce uncompensated care for healthcare providers who are already stressed. This includes small rural hospitals that struggle to maintain labor and delivery services. Amiskey Healthcare, a federally qualified health center in Manchester, informed me that last year they provided unreimbursed care for approximately 250 children and obstetrics patients related to immigration status at a cost of $150,000 to $200,000. And you'll hear from some people who will come and speak also about efforts to obtain health care for people who would otherwise be eligible, where healthcare providers were thankfully willing to provide unreimbursable care. While there will be a cost for easing Medicaid and CHIP eligibility, the federal government will pick up much of it. Eliminating the 5-year wait for immigrant children and pregnant people will send a clear message that we welcome and value newcomers to our state who enrich our communities and add to our workforce as employees and entrepreneurs. So, I also wanted to point out now, and maybe we could save the discussion of this, or people could certainly ask questions of this, but about this, but we can have a discussion about it when we exec this bill. The appropriation in the bill, as is written, is $118,000, and that is a product of the bill that I had written last year and that we discussed last year. And that was when there was only 6 months left in the fiscal year, in the biennium coming up. So because it was so difficult to get changes made through OLS at the very end of the filing period, that is not an accurate amount. The fiscal note of what it will cost per year, which is $224,000 in state funds, is accurate. But the amount that will be needed for the rest of the biennium, which will now be 18 months, is, I believe, $336,000. And I have an amendment that's written to reflect that, and I'll pass that out. And I am certainly willing to take questions.
Thank you. Yes, Representative.
Thank you, Mr. Chairman, and thank you for taking my question, Representative. Lawfully residing, is that the criteria that you list in your statement on paragraph 5 of the, is that what lawfully residing means? Those criteria that are listed in that paragraph? You know, having a green card or asylum applicants, et cetera, is that lawfully residing then?
Thank you for the question.
Yeah.
You should have a packet, in your packet of things is CMS guidelines on this option. Do you have that?
I don't know. I haven't read it yet, so.
Okay. In that, in those guidelines, it lists a number of categories of immigrants that qualify under lawfully residing. I will be honest with you, it's, even though I've put a lot of time in this and I found an expert in Los Angeles who knows this up and down, it's incredibly difficult to understand. So 2 points that I want to make about that. Number one is that I think we tend to have a very binary view of immigration. People are either documented or they're undocumented. And that, I've learned, is not the case at all. There are many, many shades of gray, probably hundreds of shades of gray. There are a lot of people who are here lawfully residing, who are not citizens, who are not permanent residents yet. So that guidance explains all this, and these are the people who would be the biggest beneficiaries in this state. And I would say also about that, and maybe somebody from the Department of Health and Human Services can respond to this as well, that right now people apply for Medicaid and they have to be determined to be eligible or not. And obviously the biggest thing is by income. But they also have to decide whether, the state has to decide whether they're eligible or not based on who has this 5-year waiting period. So the state, through their district offices and maybe with help from the central office, already makes these determinations about these various categories of immigrants. And what they will have to do is say, well, now these people are not eligible because they're on this 5-year wait. And these same people, if this law was to be passed and it becomes statute, now these people are eligible.
Great, thank you. I do have that deep in here somewhere.
Representative Leon.
Thank you, Mr. Chairman, and thank you, Representative Shapiro, for bringing this back this year. My question was about the numbers that you gave from Amascog. It sounds like those numbers were pretty close to what you had for the fiscal note. Was all of that uncompensated care related to legal immigrants, or was that from out of a larger issue in the healthcare system?
Thank you for the question. My wife read this and she said she thought that might be a little confusing. So those are not apples to apples and oranges to oranges. I think the point of that information from the Federally Qualified Health Center is just that they give a tremendous amount of unreimbursed care to people who, for various reasons, do not qualify for health care because of immigration status. But they're not necessarily the same people who would be, whose eligibility would change through this law. Does that make sense?
That's very helpful. Thank you.
Other questions? Yes, Representative.
Thank you, Mr. Chair. Thanks for taking my question. So I'm an immigrant myself and just brought in my mother several years back. And she, in that 5-year waiting period, was eligible through the healthcare marketplace to have health care, and it was based on her income, which was nothing because you're not allowed to work in those 5 years. So that monthly marketplace healthcare was very, very inexpensive for her during those 5 years. So wouldn't that still be the case for who was mentioned in this bill?
I am certainly not an immigration lawyer or expert, but if I understand you correctly, you're saying that they were involved in getting a green card or had already gotten a green card?
In process of
In process of.
Yes. And I have documentation of the paperwork that she provided, to the marketplace to get that. And I know that there is an international institute here based in New Hampshire
Right.
that I believe guides people, through that process. So does it have to be, expanding the Medicaid? Are they just not eligible? Or is this bill saying they're not eligible for that marketplace health care?
Not the marketplace healthcare, but my
Why-
understanding is that if they had just gotten their green card, and of course this only refers to children and pregnant women. It's just a sliver of the people in those situations. That if they were children or pregnant women, they would have a 5-year wait before they would become eligible for Medicaid or CHIP. And if this bill were to pass and there was to be a Medicaid amendment, that would not be the case. So I think that it's correct that they could get other insurance through the ACA, but not Medicaid and CHIP.
All set? Okay. Other questions? Seeing no other questions. Yes.
Thank you, Mr. Chairman, and thank you for taking my question. So, since a lot of states have already done this, where the 5-year waiting period has been removed, what kind of evidence do we have of the benefit from either like a health or a health care utilization or, improvement in health outcomes or decrease in costs because of not deferring care or all these other reasons that would be the reason, the usual reasons for why providing people health care coverage is a benefit of not just to the people but to society?
I don't have specific data about how this change in those other states has affected specific health outcomes or even people accessing healthcare. I'm sure there is that data out there, but I don't have it.
Okay. Thank you. Other questions? I see no other questions. Thank you. Representative, did you fill out a pink card, by the way? We don't seem to have one for you.
I collect all the pink cards, so I thought I didn't have to
I
fill
didn't-
one out.
but did you complete one?
No, I will do that. Thank you.
Thank you. Okay, also signed up to testify today is Representative Jonah Wheeler. You have 3 minutes, sir.
Thank you, Mr. Chairman. I don't think I'll need 3 minutes. I'm one of the co-sponsors on the bill, and I appreciate you giving me the time to speak today. I just want to reiterate what my friend from Keene said about this legislation. I think there are a lot of people here in this state who are in a gray area, not necessarily documented nor undocumented, and those people deserve health care. And if we give them that health care, we can help prevent greater diseases or injuries that they might get, and having them having to go to the emergency room which would be an even greater cost to the state if we had just provided this care to prevent those issues in the first place. To Representative Mazur's point, I think the marketplace, there would be a place for them in the marketplace. I think the problem with it is Medicaid and CHIP, the services given by the public sector, are by many measures significantly better than what's given on the marketplace for lower income folks. If you have, there's a number of examples, and I'm no insurance agent, so I won't give out those examples, but there are a number of examples of how Medicaid doles out better services than the private industry can. And I think the people who would be eligible based on this bill would be the people who receive those services. So I think it's important that we protect them under this legislation and make sure that they're not left to the whims of the marketplace, which can itself be a pretty dangerous place. Those are the points I wanted to make, Mr. Chairman. I think that we have some people in a gray area who need to be covered. I think the price that Representative Shapiro has brought forth is well established and would be worthwhile for the state to incur to allow those people to be covered and make sure that we prevent any other greater costs from happening in the emergency room later on. So I thank you for your time and urge the committee to pass this legislation OTP.
Thank you very
I'll
much.
take any questions if there are any. But
Any questions? Okay, seeing none, thank you.
Thank you, Mr. Chairman.
Okay, I'd like to welcome back Henry Lippman and Rob Berry from the Department of Health and Human Services. And please don't take 8 minutes.
Good afternoon again for the record. Henry Lippman, Medicaid Director, and we will not take 8 minutes. I guess just trying to fill in a little bit of some of the testimony you've heard from others. So I think in terms of the benefit to the state in terms of offering this is, it begins with the presumption that the person is Medicaid eligible except for the time period, the 5-year waiting period. So if a woman receives prenatal care, the child gets child care visits. If they in fact continue to reside in New Hampshire and they're healthy to begin with, I think that's the benefit that the Medicaid program would share from a perspective as to why to do this. Back when this was introduced last year, the expert that Representative Shapiro who came up with that estimate, we also ran it by our actuary, and we're pretty close on our numbers. So I think the number's credible in terms of what's for the updated number as you described it, Representative Shapiro. Be happy to answer any questions, but I think, trying to stay within the 3 minutes.
Sure, I appreciate that. Any questions for these gentlemen? Yes, Representative Weber.
I just had one, which is it's a little outside your field, but I know you've done work in other places other than our Medicaid program. It is true, is it not, that if somebody shows up at our emergency room with an urgent medical issue, nobody stops and finds out whether they're in a gray area or the 5-year look-back period. They're just treated, and then the costs may simply devolve down onto uncompensated care. Is that correct?
Yes, I think it's correct. And I just think if you look at what the focus of this bill, it's a pregnancy, right? It's going to happen. And the issue is that it's not, if you will, delayable like maybe other chronic conditions and things like that. That's, I think, the costs to the system are guaranteed to happen. And they can be even worse if they don't get the right prenatal care. You can end up in a situation where we're, neonatal situation in an ICU where, you know, that if they show up at a center that does that because they haven't received the right prenatal care and care all along, it's a cost that gets built into the system that we all pay for outside of Medicaid as well.
Thank you.
Other questions? Representative Nagel.
Thank you, Mr. Chairman. Thank you for taking my question. Simple question. Do you have any idea what percentage of these people will eventually become citizens of the United States?
That I don't know. I've just focused, if you will, on the Medicaid component of this.
Thanks.
Sorry.
Thank you.
Other questions? Yes.
Thank you, Mr. Chairman, and thank you for taking my question. So I'm hearing this right. Except for the fact that they are here, they have to wait 5 years. They are otherwise lawfully, citizen or present in the United States, and they qualify otherwise for Medicaid. That if they got to that 5 years or they were not in one of the qualifying categories, they would have Medicaid right now. Is that correct?
Yes.
Okay, thank you.
Thank you. Other questions? I am seeing none. Okay. Thank you, gentlemen.
Thank you.
Okay, also signed up to speak today is Jane Shapiro from Project Home, representing Project Home.
Thank you, Chairman McDonald and members of the committee for allowing me to speak to you this afternoon. I'm Jane Shapiro from Keene, a resident of Cheshire County for over 46 years, and I'm here in support of House Bill 282. Last December, the Kaiser Family Foundation reported that in 2021, 25% of lawfully present immigrants were uninsured, compared to 8% of citizens. And I think Representative Shapiro did an excellent and detailed job of explaining what lawfully present immigrants were and the fact that this bill affects only pregnant women and children in that category. This is because lawfully present immigrants more often work in jobs that do not provide health benefits, and because they face eligibility restrictions for public coverage, including Medicaid, CHIP, and Marketplace coverage. And I'd like to speak to the question from the representative, Mazur, about Marketplace insurance, because I have personal experience trying to get some lawfully present immigrants into that program. And they couldn't do it because they didn't have Social Security numbers. And I spent the better part of an afternoon with them in the office of Cheshire Medical Center's designated person who does this every day and enrolls people in that insurance. And the reason they didn't have a Social Security number is because they hadn't yet gotten the work authorization. And the work authorization took 2 years and 9 months to get, even though they had gone through all the documentation and filed all the legal applications for asylum with attorneys and according to the letter of the law. So there, as Representative Shapiro says, there are many shades of gray, and the people that I have worked with fell into a different shade of gray than your mother, so I have concern for them. Since 2016, I have worked with lawfully present asylees in the Keene area through a program called Project Home. New Hampshire's 5-year wait requirement for Medicaid means that our local providers and nonprofit medical and dental providers have had to decide whether or not they will provide free care. Dental care is particularly difficult to find. Fortunately, our health community stepped forward, but it's burdensome, and there will be a limit to what they can provide. Let me put a face on those with whom I've worked. A family of 5 who fled with the clothes on their backs as they faced life-threatening violence. The parents could not work here, this is the person that I referred to earlier, until they received work permits and Social Security numbers, and that took 2 years and 9 months. The mom is now a housekeeper in a nursing home, and they've told me they really want to clone her. The dad is working to start his own business. Their children would be eligible for Medicaid if House Bill 282 passes. Or 2 teenagers who fled physical and psychological abuse and poverty. Now Keene High graduates One is thinking of college and medical school, and the other wants to start her own business and is working in her field of choice. They would be eligible for Medicaid if House Bill 282 passes. Or a young mom who arrived with a newborn and 2 young children, who now works full-time at a local company, has her driver's license and a car. Her children would be eligible for Medicaid if House Bill 282 passes. Or the pregnant mom with 2 young children who just arrived like 2 weeks ago. If House Bill 282 passes, they would qualify for Medicaid after they have been here 180 days instead of 5 years.
Ma'am, if you could start wrapping up, please.
Yes. These families have been fortunate, but many in our state have not, because they're fortunate because our community has stepped forward. And I urge you to do whatever you can to ensure that we join the other 35 states who have eliminated the 5-year wait period. And I thank you for your time and the extra time.
Thank you. Thank you. Questions? Questions from community? Yes.
Thank you, Mr. Chair, and thank you for taking my question. Just to, though, clarify on your response to Representative Mazur's comment, when I married my wife and brought her over as an immigrant, it took me 10 years to get her work papers, but she was able to get an individual taxation number, which is equivalent of a Social Security number, except that it does not allow you to work. And it was my understanding, at least in our case, that we were able to do everything with that ITN, except obviously work, because that was the condition of her visa. So I just wanted to clarify that a bit.
Thank you for that comment and question. I'm no authority, but I can only say that the people that I have worked with fall within the narrow category of asylees, asylum seekers. And so they have, they're all different categories and different rules. I don't know the category under which your wife, fell, but I do know that my experience, and I have talked directly with the Social Security office in Keene and worked very hard on this issue, and I can just speak from my experience. I don't know all the legal citations that I can answer you more officially.
Other questions? Yes, go ahead.
Thank you, Mr. Chair. Thanks again for taking my question. So, because you referred back to me about that, so to kind of answer what you mentioned to me about not having Social Security, didn't have any of that either. So the only thing, and so I guess this is a question, is it not right now permissible to submit an I-485, which is an application to register permanent residence or adjust status? That's all that was needed for us to get health care.
I can't answer that question. I can just say that the person who has given me the information that I just shared with you was the patient representative who does this all the time. And she actually got on the phone and called several of her contacts in Concord as we were trying to make this application. And the end result was you have everything in place except the Social Security number, and therefore we can't process your application. So I can't answer it any more specifically than that. I'm sorry.
Okay, other questions? I see no other questions.
Thank you very much.
Mr. Chair, I'd just like to point out that there is a representative who passed in a pink card and who has a little baby who's waiting to testify. So
Okay,
I don't.
They did pass in the pink card? I'm sorry, I didn't see it.
Representative Toll.
Okay. Well, thank you for pointing that out. And by the way, have you done yours yet? Too early to tell. Okay. Okay.
Representative Toll, it's written on the edge.
Okay. Yes, Representative Toll, if you'd like to come forward, and I apologize, I didn't realize that you were one of us, so thank you.
No need to apologize. Thank you so much. Honorable members of the Health and Human Service Committee, I am here today as a co-sponsor of the bill and just really grateful to Rep. Shapiro for bringing it forward, and I'm here to speak in support of it. Access to health care is a critical need, particularly for pregnant people and children. Prenatal care reduces the risk of pregnancy complications for both the pregnant person and the child. Both groups suffer the consequences of a lack of health care, potentially for the rest of their lives. Currently, immigrants, some of them wait 5 years to qualify for the federal benefits that would make health care accessible to them. And New Hampshire is the only state in the Northeast that has not eliminated this 5-year wait. Access to prenatal care and health care for children is not just an investment in those who receive the care, but also an important public health investment which will save money through both prevention and timely diagnosis. Not only that, but making healthcare more available to folks in our communities will let them know that we welcome them and we value their presence in our state. We know that immigrants enrich our communities in many ways, and this bill affirms that. This bill is not just a healthcare justice bill, it's also an immigrant justice bill. Healthcare is a human right, and everyone deserves to be treated with dignity and respect. I urge you to demonstrate your care for children and their parents by voting in favor of this legislation. There's one more thing I actually just want to say that wasn't part of my prepared speech. I became like a new mother to this one 8 weeks ago, and I cannot imagine how difficult it would have been to not have access to care while I was pregnant. I got a terrible case of PUFFs. I got extremely anemic and needed iron transfusions at our local hospital. And then when I had him, even though I was healthy and I have a lot of support, it's still a challenge. I walked in and got sworn in when he was a week old, and I could barely walk, even though I was smiling, you know? And you're tired, and this is in the best of circumstances. And so I just really want to advocate that this is compassion, this is empathy, and as legislators, there's no better way to legislate than from a place of empathy and compassion. So I really urge you to pass this. Thank you so much.
Thank you. Questions? Seeing no questions? Okay, thank you.
Thank you.
I'm sorry, Representative Weber.
I'm just looking at your fellow testifier and wondering how much weight he's gained over those last 8 weeks because he's enormous.
Yes, he is. His dad's a gentle giant, so a really big man. So he must have gotten his genes. He's doubled his weight since we were here. So, yeah, thank you so much.
Thank you, and I apologize for the personal question, but it was irresistible.
I appreciate it. I know some things, like in this amazing body, we cannot agree upon. We just have to agree to disagree. But one thing I think we can all agree on is Jordy's pretty cute, and he deserves a little bit of special
Well, we can't
attention.
see his face, but we're sure he is.
Thank you.
Could we get a copy of a written testimony, please?
Yes. I only have one. Is that
Yeah, it's just for me.
Okay. Also signed up to testify today is Richard Bernard from Building Community in New Hampshire.
Thank you, Mr. Chairman. My name is Richard Menard. I'm the Executive Director of Building Community in New Hampshire. And I should start, I suppose, by saying I, too, am not an immigration attorney. But I do run a nonprofit organization based in Manchester that helps refugees build successful, prosperous, and healthy lives here in New Hampshire. And I'm here to support the bill. You're all correct that the immigration system is very complicated. I get emails like once a week from Boston, from the National Federal Office of the Immigration Service, changing various groups' statuses. They go from temporary protected status to humanitarian parolee and on, and it's complicated, and it's almost impossible to identify particular groups who will have a particular status for a long time. I can tell you that we are currently working with people who came a year or so ago from Afghanistan as humanitarian parolees, and now people from Ukraine who came as humanitarian parolees. And both of those groups would be in this 5-year trap that this bill is about. had Congress not specifically authorized Medicaid for them. And I don't know who the next group of people will be and whether Congress will authorize Medicaid for them. It appears that Venezuelans now have access to asylum and all the privileges of other documented legal immigrants in the United States. Whether they come to New Hampshire or not, who knows? But if they do, I hope that the mothers have access to prenatal care and that their children have access to Medicaid. It's important for all the reasons you've heard. It certainly saves money in the long term and having healthy outcomes from pregnancies. And I would only add that for New Hampshire, having a really strong and welcome community of new Americans is enormously valuable. Much of the work we do is to help refugees find employment. And we find employers all over the state clamoring for more people who can come work for them. The people we place are great employees. Many are making $18, $19, $20 an hour. It's not the system that many people have in their mind when they think about immigration, trucks pulling up to corners and putting in low day laborers. That's not what's happening in New Hampshire. People are here, they're living, they're working really hard, and they're in important jobs in manufacturing and healthcare and everywhere else. And the need is great for more, frankly, for our economy, our well-being, and to reduce that aging population that we all worry about. So I think this bill is a step in the right direction for creating a vibrant and diverse community. And I thank the representative for introducing it. Thank you. I'm happy to answer any questions.
Thank you. Questions for this gentleman? Representative Leon.
Thank you, Mr. Chairman, and thank you to catch you at the last moment. Do you think that if we do this, this would actually be a draw that would have more immigrants moving to New Hampshire
I doubt
if
it.
we offer this?
I doubt people will know enough about the state's peculiar laws to come here because of it. But they might stay if they're here because of it. People leave. An Afghan man who was working at Pitco just left for California, mostly because of family reunification. This is actually a pretty difficult state to live in if you're low income. And people leave. Virtually all of the Rohingya refugees have left Nashua, for example. Half of the Bhutanese have left Concord and Manchester. And I think that's a real loss to the state. Having a bill like this is a way to say, we value you here. We want to make sure you're well and healthy and hope you stay.
Thank you. Other questions?
Yes.
Yes, go ahead.
Yeah, and I just want to clarify because, I think immigrants, when they come in, should have options. And it was a little bit concerning to me to hear testimony. Maybe those people on the low end, maybe the Medicaid option is a route for them. But for those that have maybe a bit more means, to find out that the exchange is not an option. Has that been your experience as well?
Well, what can I say? The exchange is really important. For most people, their first recourse is Medicaid. For most of the refugees that we see, they start with Medicaid. And you're right, as they get more settled here and get more sophisticated about how the system works, many do choose to purchase their own insurance, or they may get it from their employer. So Medicaid is not the only option, but it's certainly important for all the reasons that we have it.
Representative Weber.
I'm just wondering about a point of clarification because it seems to me like we're getting into comparing apples and oranges territory here. If you know, and if you may not be the right person to ask, and if not, I'll go and bug somebody else later. But isn't this bill aimed at asylum seekers who are in the category of people who may not work because their status has not yet been regularized to the point where they may work, as opposed to the people that I heard you speak of who are working and therefore have more options available to them than those who are not allowed to work?
Thank you for the question, and also for giving me an opt-out. My understanding is that the bill is open to other people than asylum seekers. And I'll let Representative Shapiro explain his research more fully.
Okay.
But there are people here who can work, who are legally residing, who are not refugees with all the benefits that come with that official status, and who also may not be seeking asylum.
Other questions? Seeing none.
Thank you very much.
Thank you. Also signed up to speak today is, and I may mispronounce the name, so I apologize if I do, Hanan Bedri from the New Hampshire Public Health Association. You have 3 minutes, sir.
Thank you for allowing me to speak.
Sorry. You have 3 minutes, sure. Go ahead.
Nonprofit Public Health Membership Association, founded in 1992. We're a leading, trusted New Hampshire public health voice that empowers our members and communities to achieve a healthier New Hampshire. Our mission is to improve the New Hampshire public health. New Hampshire has the New Hampshire Public Health Association has over 300 organization and individual members. That includes our members who represent the Department of Health and Human Services, local health departments, public health networks, hospitals, federally qualified health centers, community-based organizations, social service organizations, and many more. I'm here today in support of House Bill 282 on behalf of over 300 public health organization and individual members. New Hampshire and its public health members aim to improve New Hampshire's health, prevent disease, and reduce costs for all. We support House Bill 282 because it invests in the public's health by improving the health of the society, including those who are lawfully residing in the United States. The bill also advances equity and fosters economic resiliency. The population in New Hampshire is aging, and baby boomers are retiring. 60% of our high school seniors leaving New Hampshire to enroll in colleges and in other states. Recent data have shown a significant population turnover in the state of New Hampshire. We need people who want to be doctors, nurses, teachers, and engineers. Therefore, we need to invest in their health, especially those who are lawfully residing in the U.S., including temporary protected status individuals, asylum seekers who have worked who have work permits, and those under family unification working on getting a green card. We need everyone who's here to be able to reach their potential. Therefore, we need to start by investing in their health. They are part of New Hampshire's future. When we invest in them, they will put their skills, assets, and potential to work to make our communities even better and healthier and keep our economy growing. This bill will also expand coverage to pregnant women and children who are lawfully residing in the United States. The option to provide Medicaid and CHIP coverage to pregnant women and children without the 5-year requirement has been available in other states since 2009. New Hampshire is the only New England state that has not implemented this option. 35 other states invest in children and families by offering health coverage option. Passing House Bill 282 will improve the health of all moms, babies, and families. On behalf of the association and its members, I ask for your support of House Bill 282 and that you encourage your colleagues to find the bill ought to pass. I was an asylee, and I was granted asylum back in 2005, so I know exactly what people are going through, kind of. So I support this bill very strongly.
Great. Thank you very much.
Thank you.
Any questions? Not seeing any questions, so thank you very much.
Thank you.
Also signed up to testify is Bob Dunn, representing the Roman Catholic Bishop of Manchester.
Thank you, Mr. Chair, members of the committee. I'm Bob Dunn, Diocese of Manchester. We support the bill, everything I said earlier. Thank you.
Well, that was quick. Any questions? Oh, this was a quick one. Quick and easy, thank you. Next up is Jake Berry, representing New Futures. I know.
Good afternoon, Mr. Chair, honorable members of the committee. My name is Jake Berry. I'm the Vice President of Policy at New Futures. I'll try and keep this brief. Bob Dunn is a tough act to follow. As many of you know, New Futures is a nonpartisan, nonprofit health policy and advocacy organization. As New Futures authorized Kids Count organization, we advocate for data-driven policies that support Granite State children and families. As you've heard throughout this afternoon, legally residing immigrant families often don't have access to the health care they need. Because they're forced to wait this 5 years to access Medicaid and CHIP, they're forced to rely on the marketplace or other high-cost insurance alternatives or to forego insurance coverage entirely. This negatively impacts not just their current access to needed health care, but it can contribute to higher poverty levels and other adverse childhood experiences, which are known to impair children's brain development and lead to negative health outcomes throughout the lifetime. Further, as Representative Weber noted earlier, healthcare costs incurred by these individuals can lead to higher rates of uncompensated care, which can put added pressure across our healthcare system and lead to higher premiums across the board. Investing in these children and families by eliminating the 5-year wait as proposed in this bill would improve the physical and financial health of these families and our state as a whole. And we ask you to vote this bill ought to pass, and I'm happy to take questions.
Thank you. Questions? Any questions for this gentleman? Representative Leon.
Thank you, Mr. Chairman, and thank you for being here and speaking to the exchange. You spoke to the price point, but have you seen any problems with people accessing the exchange, or has that been an option for this community?
We don't work as directly in this community as others here, so I'm not sure I can speak to that. Certainly, we are always concerned about individuals who are not able to access public health insurance or employer-based health insurance and their ability to access the exchange, both due to price points and just the overall complexity of the system. So we think that a public option like this is really critical in terms, especially for individuals like this who are new to the United States and new to the system. Offering this, Medicaid or CHIP as sort of first step health coverage is really important.
Thank you.
Any other questions? Seeing no other questions, so thank you, sir. And the final person signed up to testify on this bill is Nancy Pierpont, representing Sandra Kencher, I'm sorry.
So I did chair the Immigrant and Refugee Support Group at the New Hampshire Conference United Church of Christ, becoming a member in 2012 and chairing it from 2013 to 2022. Could possibly answer many questions, even though I'm not an immigration lawyer. So I invite you to listen to this letter very carefully and ask me any questions you might want to after you hear what Sandra, now my good friend, wanted to say to you. She couldn't be here because she was called into work. She works at a nursing home. She's a licensed nursing assistant. Hello, my name is Sandra Kencher, a Nigerian immigrant, married with 3 children, 2 boys and a girl. I am writing to support HB 282, which will allow pregnant immigrants and minors to get health care. When I became pregnant in August of 2017, I was living in Dallas, Texas. I was able to apply for a type of medical insurance through the state, which is called Medicaid. It's like Medicaid. That insurance covered both my unborn child and me, and included postnatal visits as well. I was so relieved because I didn't have to come up with $6,000 or more for hospital bills. In November of that same year, however, my husband was placed in immigrant detention and transferred to Stratford County Jail, which is here in Dover, New Hampshire. That meant that my 2 boys and I needed to come to live in New Hampshire. Before we could make a decision to come, the Immigrant and Refugee Support Group at the New Hampshire Conference, United Church of Christ, had to look for an obstetrician that was willing to take care of me and help me with the delivery process. Fortunately, the group found Dr. Perkins. Garrison Women's Health offered to donate their services for my prenatal and postnatal care because the state of New Hampshire does not have any program that covers pregnant immigrants. My boys, who were 3 and nearly 5 then, couldn't get any medical insurance through the state either. I'm very grateful for the help offered to me and my family by the Immigrant and Refugee Support Group and Garrison Women's Health. I recently learned that the reason they needed to help me was that the state of New Hampshire hasn't opted in to the same federal program that was available in Texas. My family was recently granted asylum. During the wait, I earned my certification to be a licensed nursing assistant. Now I work as an LNA because I love helping people. I work in a nursing home and sing for my patients to make them happy. I'm also taking classes at Great Bay so I can become a registered nurse probably in 3 years' time. I hope that the state of New Hampshire will opt into the federal program. More immigrant health workers like me are needed in New Hampshire, and having this insurance available would be one less obstacle to their coming. It's only by God's grace, in the form of the Immigrant and Refugee Support Group and Garrison Women's Health Center, that we made it here.
Does that conclude your testimony? Or?
That's it.
Great, thank you, perfect timing. Any questions? Representative King.
Can I have a copy of the letter from
Sandra, yes.
From Sandra?
Yeah, you can
Thank you.
have the copy of that.
Just for our records.
Yep.
Thank you. Any other questions?
I can say, I've heard a couple people talking about the gray areas, and as chair of that group, I can testify there are many gray areas, one of them being an administratively closed case. So there are people here who have gone through the asylum case, got to the judge, and he said neither yes nor no, but said, you can stay here, you can work, but I don't think I want to put you on a path to citizenship. That's a gray area. So there are many, many gray areas that exist. So if you're thinking it's just this or that, no. Representative Shapiro was exactly right. There are tons of gray areas.
Okay, thank you very much. Any other questions from the committee? Seeing none, I have no other cards filled out for people wishing to speak today. Is there anyone in the audience who does wish to speak on this bill? House Bill 282. Seeing none, I am going to close the public hearing for House Bill 282. We have no other bills noticed for a public hearing today, so that concludes our business today. We will be reconvening tomorrow afternoon at 1 p.m. here in this room. Thank you all.